creative and playful pathways to treat acute, complex, and attachment trauma. Just a couple little announcements before we get started. Chat will be open periodically throughout the day. It won't be open the whole day, but periodically Dana will pose questions to us, our speaker, Dr. Wyss, and we will interact through the chat during those times. And then Q&A will open up for everybody half an hour after we begin. And those are for your content questions for Dana. Okay, it is my great pleasure to introduce Dr. Dana Wyss. She is a board-certified art therapist, marriage and family therapist, and holds a doctorate in expressive therapies. She is also the co-author of the Invisible String Workbook. Welcome, Dana.
Hello, and good morning to everyone. So glad to see everyone here. Let's go ahead and get our slide share started. Thank you all for joining us. I am really excited to be able to offer this and just share some of the tips and tools that I've gathered in my 25 years of doing this work so far. I think that's the right number. I don't want to go any higher yet. And just a little note, I will be showing some client work and some other work, some art by other artists. So I just want to kind of note here that everything in here is either created by myself, created by an artist who is noted on the slide, or I have permission for everything shown here. So that's something that I think is really important when I think about sharing artwork or sharing pictures or sharing anything from my client work or anyone's client work is making sure we have those permissions and they also know that it's in the show. So I also talk to all my clients before I put something in any kind of presentation so they know where it goes and what it's part of. And I will talk about that as we go throughout the presentation where that shows up. Meg did a great job already of introducing me. And Meg, we forgot to add one more thing. Now play therapist. I just got my certificate. I just finished that. And I am maybe 2 months away from EMDR certification too, or from training, EMDR training. So that's pretty exciting. Adding that to the list of things, which we'll talk about a lot through this time, is just continuing to learn and continuing to really do the work, both on yourself personally, but also professionally, to stay really in this field and doing the work of trauma, which we're learning so much about. From the time I started in this field to now, so much has changed, and there's been so many great growths, and we've learned so much, but it can also be really overwhelming, and that's what we'll talk about a lot today too. Our objectives, there are a lot of objectives because this is 2 days. This is all in your handouts. So I see that they have put those in the chat for you to be able to grab, but we also will go through the objectives and show in the different sections which objectives we're going over. So we won't spend a lot of time on them right now this morning. Next is scope of practice. Just remembering that there's a lot of materials that are included in this presentation. We will talk about some of the different modalities of trauma treatment. We will talk about art. We will talk about play. And just remember, if you are not even a therapist and you're just on here joining to learn more, that some of these things you may not be able to use with other people. And then also we will talk a little bit about scope of practice with play therapy, art therapy, music therapy, just these different types of therapy, and everyone being able to use creative means, but also just being mindful about how we discuss and talk about that, and also what is within our scope. And then conflict of interest. Just know that they were disclosed prior to the start of this presentation, as Meg pointed out. We will talk a little bit about a book that I published. We will do some activities from a book I published. So those things are here and they're present. And we hope that you enjoy everything that we share in this presentation. So let's get started and start to dive in. Preparing for trauma work, foundational considerations. So this is just the bones of everything. So throughout this training, how I created it was really thinking about what is in almost all the trauma models. What are some of the basic fundamentals that you're going to see woven through most of them? And then also, how do we break down, not teaching you all the other modalities, but how do we break down what I'm going to add to my practice or to my work? Because I think just in this presentation, I want to say we have 8 or 9 options, and that's so many. There's so many options and there's so many ways to support people and help people, and it can get overwhelming to know what to choose. So kind of a lot of the 2 days is just what are those fundamental things I think is really important for anyone to know, no matter what modality you use. And then later on tomorrow, we're going to break down, how do I decide where to dive deeper, what to do next? And we'll have some kind of tips and things that I've created to support you in that process. So we have to start at the foundational considerations. That's the best place. And this is something I created thinking about what we hope the healing process will look like. Someone comes into our office or we ourselves are healing. The adventure begins step by step. You get there. It's just a really clean process, right? You just go there. Unfortunately, that is not what it looks like. Healing looks a lot more like this slide that I created. It's a lot more like there's certain ways to go. You never know where to start or end. You could end in different places, and you may go to a place that's not really open yet and it's closed for construction. You have to go back around the cycle again. And I think that's a really great example and metaphor for what this process can be like, both as someone supporting someone through their trauma work, but then also someone who's in the trauma work. It can feel overwhelming. It can feel scary. It can feel very messy. You can end up in the wrong place and have to start over again, or feel like you have to start over again. All these things can happen. And one of the things that I say to everyone, I've been a supervisor for many years now, and I still always have my own supervision or consultation. So no matter what work I've done, for a long time, I worked in a residential hospital, a psychiatric hospital, and a group home for adolescents. There was tons of supervision and consultation all over because I had tons of managers that were also licensed. I could, get feedback from and make sure I'm on the right track with clients, or even with the people I was supervising, make sure I'm on track, make sure I'm getting things right. And then now I'm in private practice, and because I just did my play therapy, I kept my supervisor from play therapy, and that's the person that I'm able to use to consult with. Now that we don't need supervision anymore, that's just my consultant, and I see them a couple times a month, and that's who I consult with. And then when I have specialty things show up, I'm able to pull people that I know and always have that consultation or that support, because we can get just as lost as our clients in this mess and in what's happening. Trauma and grief work are about walking beside someone through the darkest moments of their lives while still holding on to yourself and your hope. You cannot take anyone further in the journey than you are willing to go. A lot of the modalities I've studied and the things I've learned is that you can't take anyone further in healing than you're healing yourself. And also that there is huge importance on being able to hold the hope. I have a picture. I should put this in the slide. I'll have to put it during the break. I'll slide it in here. I just bought a picture for my office that's over here. I'm pointing over here because I'm staring at it. And I always talk about holding the hope. We do training on trafficking as well within my company. And we always talk about we have to hold the hope for someone, even if they can't see it, even if they can't come and get it. And we talk about the candle in the window. and that we will be the candle. We have to keep our candle lit. We have to keep our flame lit, and we have to keep it going no matter what, no matter how hard it is, because you never know when they're going to see it and need it. And even if someone is just walking by the window and it's not time for them to come inside and get the support, just knowing that it's there can maybe be that safety they needed, or can maybe be that little bit of hope that keeps them going. And that's a metaphor we've talked a lot about in that work, because we would often have kids kind of come in and then leave, and come in and leave. And it was always hard on us. And we would start to lose our hope. Like, what are we even doing? And we'd have to remember that they keep coming back. There's something we're offering that is supporting them enough that they are seeing something that they had never seen before. They're getting something. And so this picture in my office is from an artist. I'm in California, and they have a gallery down in Laguna Hills. And it is this little robot character holding a light bulb up and saying, if you have hope, it's never dark. And so I think that's really, really important. And that is really important to me, that if I start to see my hope slipping, or that I'm losing that I need to reinvest in myself, that I need to recalibrate, and I need to figure out how to get that back, because the only way I can support my clients is if I'm holding it for them. And for many years, when I was in the inpatient setting, sometimes we were holding the hope from them, and they had no hope at all. There was many nights that my colleagues and I sat with youth for long periods of time that just didn't want to be alive anymore. And just sitting with them in that and being able to hold that for them, sometimes in silence for long periods of time, just sitting next to them and keeping them safe, was so important. And we were able to do that for each other a lot of times, is give each other hope and make sure that we kept it there. The next really important piece, which kind of goes into what we were just talking about, is relationship. Many of the books, many of the models, many of the experts who have come before us will tell you, you could do every single thing perfectly. If you have no relationship, it won't matter. That is fundamental. What relationship do you have with the person in your space? Do you like the client that's sitting in front of you? I don't mean like your best friend, but do you enjoy that client? Are you able to see them and see the whole person? And that's really important. And I think that I have supervised so many people over the years, because in the program we were in, you kind of got the clients you got, and the clients got you. There wasn't a choice. It wasn't in private practice. People get to interview me. They get to decide if they want to come to me. I get to decide if I want to keep them in the practice or refer them to someone else. Such a different world. But in kind of the settings of community mental health, and where I was in the psychiatric hospital and the group homes, a lot of times we don't get to choose that. And so this becomes even more important, because if we have a client that maybe is labeled as a little harder or a little more difficult to deal with, and people push away from them, you could be the best therapist in the world, but if you're pushing away and not building that relationship, nothing's going to happen for them, because they don't feel that safety and that trust. And the interesting thing too is, in some of the research I've done, we all know that trauma work is very intense and it can be very hard. There might be cases and times where someone's just really in the place to really move through it, and it flows a little easier, but for the most part, it can be really difficult, and it can be tough, and it can be overwhelming. What predicts burnout is someone's avoidance. The ones who burn out were the ones who were never on fire in the first place. It's not the one who has a ton of passion that's in there extra hours and doing all that stuff. A strong why and passion for jumping into the fire is what's going to keep you going. And that's all about personal connection to the work you're doing and to the clients you're supporting. So that is a better predictor about not having burnout. That's also a better predictor for the work you'll be able to do with a client that you see. All right. So diving into discovering your roadmap. So before we even get to the clients, you can already see a lot of this is already about us, what we're doing, why I'm in this work, why am I doing this? I do a lot of coaching with people who aren't sure how they want to use their master's degree. Maybe they thought they wanted to do therapy and now they're not sure. We talk about all the different avenues. How can you still serve and help people when maybe you don't want to do it on a one-to-one basis, or you don't want to be in this environment and another? I do a lot of coaching around that. So I always start with us. What is my roadmap and how do I know where I'm going? What are my next steps? Because the more I'm able to figure that out, then the better I'm going to be able to serve my clients. And that doesn't necessarily mean what's your niche or what exactly do you want to do for the next 20 years. But if you find yourself not enjoying some parts of it, that is something to question and to think about. So, who are you as a therapist, and how does that support your work with trauma? And the first question, and this is where we're going to open up the chat and be able to hear from some of you. We are going to try and make, I know it's webinar based, but we're going to try and make this as interactive as possible. So I'm hoping that you are awake with me and willing to jump in. But my first question is, what gift do you bring to your work? So an example of that is creativity for me. I bring creativity, whether I am actually doing art and play or whether it was in de-escalation, and I could think so quickly on my toes in a de-escalation moment and really support someone in problem solving. So one of everyone's favorite things was somebody would be about to escalate and I could tell they were bored, and I would walk in the hallway and I'd be like, oh shoot, I forgot to ask you if you could help me with this project. And they're like, what? And I'm like, oh, we had a bunny at the office, and I was like, oh, I needed a poster for the bunny and I was going to ask you and I totally forgot. And they'd be like, oh, Miss Dana, yes, bring me the supplies. And all of a sudden the de-escalation, it was just done. They were just kind of down there. Oh, and I love these that are coming in right now. Yes, problem solving. Yes, calm and the ability to not react. That's a big one. Little self-disclosure, I did EMDR last night with my own therapist on being neutral because this is really early in the morning for me. And I was really struggling with waking up early. That is not my strong suit. And I did EMDR on just that, not reacting to having to wake up early. I have been told by some people in my household that I can be a little snappy and not so nice early in the morning when I have to wake up. So I actually did my own work on making sure I could be present and awake and alert for everyone here. And our word was neutral. I was trying to be neutral. I wasn't trying to be happy and excited. I was just trying to be able to wake up neutral. So being able to not react is really a powerful skill. Yes, playfulness and holding. Yes, regardless of how uncomfortable either one of us is. So powerful. Lots of empathy and vulnerability, connection. Yes. Passion. Passion is such a big thing, right? Like we just read, right? If we never had the fire, that's the person who's going to burn out. If they don't have the passion for the work. If we have the passion for the work, we'll always be able to come back to our why. Yes, genuine and down to earth. We're going to talk a lot about genuineness, especially with trauma work. Being genuine is super important because someone who has experienced a lot of trauma is super hyper vigilant to read the world and to read us. And if they don't feel like we're genuine, it's over. I have a client, she's the sweetest little thing. She's 10 years old. And apparently they had tried to send her to therapy before. And I apparently was talking to this 10-year-old as if she was an adult. I didn't realize I was doing it. I was just being myself. And somewhere in the middle of our kind of introduction session where they were talking about families going through a divorce. It's not super contentious, but it is a very difficult kind of messy situation. And in the middle of our session, she looks at her mom and she goes, "This one tells it how it is. I like this one." I wasn't even doing it on purpose. I was just being myself, but for her, it was very refreshing. Yes, I love this compassion, feeling comfortable, These are so great. I know I won't be able to read every single one of these out. Humor. Yes, I love using humor at the right times in the right places in sessions. I actually have a couple of people who chose to come to me because they had heard I was funny, and that I use humor in sessions. Nice. Yes. Other art therapists on the call. Assertive and patient. That's a very good combination. Good intentions. I like that. Critical perspective. Ooh. Seeing past the behaviors, responding with compassion to problem solve. Yes. And I'm seeing a lot of passion and creativity, building rapport, transparency. All of these are so fantastic. Thank you so much for sharing. Yes, not afraid to get messy. We're going to talk about getting messy. This is all messy in multiple ways. I've never done so much slime in my life because at the adolescent center, we couldn't have slime where I used to work. And now I have slime in my office that I thought maybe one kid would use and we'd be done with it. And no, even my adults have made slime. So getting messy in all different ways, getting messy kind of mentally and like emotionally with the work, but then also physically getting messy with the stuff. And that's something to consider as we talk through this training. How messy do you really want to get, and knowing your kind of levels and what's comfortable. A lot of the same ones I'm saying, yes, no judgments. Some of these I'm not reading out is because we've had a lot that are very similar, but these are all fantastic. Thank you so much for participating. Yes, authenticity, genuineness. I'm seeing a lot of that. Yes, curiosity. Curiosity. We are going to talk a lot about curiosity. All right, fantastic. We are going to keep going, but I see that you're already in this place. Oh, I just saw one, self-disclosure. We will talk a little bit about that. Self-disclosure, yes, and it's a little bit of a fine line. But there are definitely places where self-disclosure is super important, and definitely places I won't go. And I'll give you a quick example since this is here, because I think this is really important to know who we are. A long time ago, we were working with a client who had lost a parent, and I really wanted to share about my own experience. And my supervisor sat me down and said, and I'm so grateful to them for this right now. They said, you don't ever have to tell that client what you've experienced for them to know you've experienced it. There are things you will do and say and know that someone who has not experienced it would never know. So bigger things like that may not need something I need to self-disclose, or it could be, depends on my practice and how I work, right? Sometimes in substance use work, there is a lot of lived experience that is shared. I also know a lot of people who do work with traffic victims who have themselves been trafficked, and there is some self-disclosure in there, but it has to be mindful. You have had to do the work on yourself before you disclose. And it also has to move the therapy forward. It has to be about them and not us. And that's such a fine line. So if you do that well, that's very impressive, because it can be really hard. And I do think that it is so, so important to really think about that and to really know. And if I feel myself wanting to share something, I won't usually do it in that moment. I will check in and see with someone else, because I always will have time to come back to that person. So if self-disclosure isn't something you've worked a lot on, but you're curious about it, that's one way to do it, right? Checking in with someone else. Why do I want to share this? Is this more about me, or is this really about this person? Is this my way to connect with them when maybe some other type of empathy would be more powerful? Or is this something they really need to hear, right? That this is going to move them forward. And sometimes I'll use self-disclosure by using it as a story, someone I know, right? So there's lots of ways to use self-disclosure. And I think in trauma work, that can be really powerful too, when done with that thoughtful mindfulness behind it. Thank you for sharing that. Thank you. Thank you for being vulnerable and sharing that. That's really great. Okay, we have so many great things on here. I know we won't be able to get all through of them, but I hope you were able to kind of move through a lot of these as well. So as we have the chat open, being able to see each other's. Oh, but now see, then I see another one that's so important. These are meeting them where they're at, setting boundaries. Yes, all of these things are things we're going to talk about. Excellent. Okay, let me move us through. This takes us into what is your why? You could do anything. What is it about working with people to support them through the hardest moments that draws you to this every day, right? So going back to that one kind of discussion about the passion and the fire. So what is your why? In your handouts, in your participant packets, you don't have the slides as I have them here, but you do have all the slides in your participant packet. It's more like a mini manual. It should be fillable by PDF if you're able to download it and use it that way. But if not, just know that there's some pages in the participant packet where you're able to really think about this, to think about your why. And during the break, I'm going to invite you to do that, to kind of look back at these pages and take some time to think about what is your why? What are some of the things that are important to you? Writing down these gifts, and maybe if you saw something else that you really wanted to honor and add in. Because we really could, right? We could do anything. And let me be honest, I've thought about that a lot. Like, we could do anything. There's people who just like post on YouTube and make millions of dollars. Like, there's lots of things we could do, but we choose what we choose for a reason, right? It also takes a lot of time to post all those videos on YouTube to make that much money. I don't want to take away from the work I do with my clients. There's something I get out of walking alongside people in their darkest moments and holding hope for them. That's something for me. I stand beside them and keep them safe. They're able to see that I hold the hope and take it when they're ready. Those are some of my whys. And maybe I'm doing that even for my friends because I do all this work here. So really thinking and curating your why. These all help us stay in this work. Other things to consider as we're preparing for the work. This is before we even get in the room with anyone else. As we're preparing, how much time do I have in between? I know, and I know all of you know, I don't know where you all work, but I'm guessing whether you're in private practice, community mental health, or in a hospital setting or a group home or somewhere like that, we all have different break choices. We all have different availabilities. We might have clients really close to each other. But I really think about, I know I have to have snacks. I have snacks today, by the way. Also, someone at my house told me if I don't have snacks, I'm a little snappy and not so nice. So I always have snacks. I always have to have my tea or coffee. There are things that I need before I even start my day. And then I know that there's certain clients that I have to use the restroom before they come into my office. I have to, because I know we're going to move a lot. I know we're going to be up and down a lot. I know that if I have to pee and this client comes in here, it's going to be a nightmare. I had a client one time making me do cartwheels in my office, and of course I did them. I'm very proud of myself that I did do a cartwheel, but then I decided we couldn't do any more. So I was like, I don't want to hurt myself. I'm a little older and I have not done cartwheels in a long time, but I was proud of myself. And then I started working out a little more after that. But I know when I have a client that's super active and I'm not just going to kind of do a little more sitting and watching or doing art with them, that I need to make sure to have that bathroom break before they come in. And even if that means asking them to wait a couple minutes so I can run to the bathroom and come in, that's what I need to do for myself. And that's a boundary I have to set. And my clients know that. And this client is, and that's a part of self-disclosure. I need to make sure I use the restroom before you come into session because I know we're going to be really active. And that is a way of like maybe self-disclosure where I add that in. And it's pretty active almost. I think we've had 2 sessions where not active. I don't know if we count building a fort with every object in my office as active or not, but it wasn't as active in that we weren't playing soccer or football with my bee. I'll show you my bee later. It is a bee that is crocheted that becomes a football in my office. It's safe. Other things like what that kind of goes into, what do we need before session? what might you need after sessions? So for those sessions, they're really active, but they're not really emotionally taxing. So I know I need something pre that, but after I'm fine. I just have to make sure I have enough time to clean up, because the office is usually, I will not say trashed, but there's things everywhere that I have to put back in their place for the next person to come in. So I need a little bit of time to use the restroom before that session, and I need a little bit of time to kind of clean up the area after that session. There are other clients that I know are going to be a little more intense, that we're going to go a little deeper into some hard stuff. So I might need to make sure I have about 10 minutes before the next person to kind of recalibrate myself, to ground, to do a little processing for myself, a little bit of debrief. What are the ramifications if you have not done the things above? So if you've not eaten, if you've not slept, if you've not used the restroom. I have talked numerously today already about some of the ramifications for me. If I don't sleep or wake up too early, I could be a little snappy and not so nice. If I haven't eaten, apparently, I could be snappy and I won't know. Like, I can go for a long time without eating and not realize it. So that's why I always have to have snacks. So if I start to get hungry, I can just grab it. I have to know the ramifications of that, because that's what keeps me on track. And that's, if I start to feel myself get that way, I can pull myself back and I can say, oh, you know where this is going. You know what this is about. Slow down. Also, this is something we already talked about. What if it gets really messy? What if a client needs to get messy? If you are someone who doesn't like mess, don't have things in your office that get messy. Because if you have paints in your office, if you have slime in your office, 100% of the time it will get messy, and it will get on things you don't want it to get on. As careful as my kids are, because there is certain areas that are allowed for that and certain areas that are not, they are really good with the rules around where we can get messy and where we can't. Having said that, I have accidentally thrown paint across the room. I have a lot of spin art machines, and opening the lid to one, I was telling this kid to be careful and not get paint everywhere, and I spilled paint all over the room. But you know what my trick is? I only use washable paints when we do the spin art. So I do get messy. I do have to clean it up. We have some rules and some boundaries around where we can get messy and where we can't. And I also know and understand that it could get everywhere, that I could have a kid that's going to dump it, that I could have a kid that's going to break things. And how I manage that is super important. So don't have things in your office that you're not comfortable with. Don't have things in your space that you're not sure how to use. I remember when I was first in the field, we had a sand tray. None of us had training on how to do sand tray. None of us. They're like, it's fine, just use it. I was like, this feels not great. One day I was going to try and use it, and someone was like, oh, don't use the sand tray, because we were working with adolescents who were on probation. They know how to hide things in the sand tray like contraband and then take it. So they'll pretend to be playing in the sand tray. And I was like, what? I was like, nope, not touching sand tray until I have training on it. And I think I've said I will never use sand tray since then. And now one of my very closest friends is like a leader in training on sand tray and is single-handedly determined. I do have a sand tray and it doesn't have sand yet. That's how bad this is. I have now done training on it and I feel much more comfortable with sand tray, and I still haven't put the sand in the sand tray. But that was something that I wasn't comfortable with for a long time. So I'm not going to use it and introduce it to my clients because I wasn't sure about it. It was messy. I had this thing embedded in my mind about like contraband and like taking things and then harming themselves or others. And so it's just kind of how I got introduced to it. And I had to do a lot of training to feel a lot more comfortable with introducing that into the space and be in a different space. And then the last thing here, just how intense might this session get? What do I need to prepare for? And it could be intense. I have a couple that start screaming at each other. And they actually said it was their safe space to have fights in front of me because I keep them at a certain level and I support them to think differently as they're talking. And that's really powerful. And I have to prepare for that because I know it could get heated. It's not easy, calm, comfortable all the time. It's two parents who are having slightly different views about how to raise their children. Potentially one of their children may be on the spectrum. They're not on the same page with that. We're working on assessment right now and getting them assessed. And so there's a lot going on, and there's a lot of hurt feelings, and there's a lot of kind of intergenerational stuff that's playing into it too, and playing into how they see each other and how they fight. And so it's almost like that's what we're working on, and it's going to get really intense. And I have to prepare myself and know, and I have to have a little area to breathe. So I actually have a half hour before that session, a half hour after, so that I have a little time I can maybe just look on the computer and just read or do something silly. And then I have a little time that maybe I can just decompress right afterwards. And that's really important. So it's thinking about planning and how do I put things in. And then on the right side here, just more things to think about. This is in your handout. So these are the reflection questions for you to think about as you're considering what you need to do. The next one that I think is super important. So we're going to go through a couple more, and then I see there's, I believe there's a question. So I'm going to go through a couple more slides, and then Meg, I'll check in with you to see if there's any questions. Breathing, mantra, and grounding. So there is self-care. We talk about self-care all the time. Self-care is super important. But if I always just wait for the massages and the great stuff that I want to do, the big things, the dinner with friends, I am dysregulated the rest of my life. So how do I bring myself back to myself, right? In moments throughout the time I'm working? How do I stay grounded when that couple starts to fight and I need to really assess in this moment, is everything safe? Is everything okay? Or do I need to do an interweave or something that slows this down? Where do I interject? Where do I let them go? How do I do that is through this. And where I originally learned this is when we were doing de-escalation training. I did that for years. De-escalation, and we did restraint training as well. But de-escalation is where I really got this part from, is how do I slow myself down when it's life and death, when there is serious injury. And that has also helped me in other places, because our brain and body trick us sometimes to think it's a crisis and life and death when it's not. And this is one of the ways that we did it. And we all have one. So breathing, quick, simple breathing. I'm not closing my eyes. I'm not taking a lot of time, but what is something I can do to get kind of breath into my body, and maybe exhale if all I'm doing is holding my breath. It may just be remember to exhale. The next thing is your mantra. What do you say to yourself to make sure you've got it, right? So it might be, I've got this. Mine is be the model. I'll describe that one in a second. I know what I'm doing. I'm okay, right? So it's something that reminds me that I can handle what's happening right now, and bringing my frontal lobe kind of back online. And the next thing is some kind of quick grounding tool that no one would even know if you were doing it. So some people may have a touchstone. You might wiggle your toes in your shoes. You might tap your forefingers to your thumb, drop your shoulders. I sometimes will just touch my legs if I'm sitting or even standing, maybe tap a couple times. So this process is quick, subtle. I just did mine. You probably didn't even notice me doing it. Why be the model? Originally, when I got into the field, it was, this isn't about me. So when I had kids screaming at me, parents screaming at me because they're in locked placement, right? Kids are angry they're there. They don't want to be with some therapist. They're being told to be here by probation or DCFS. Parents are angry and defensive because their child's been pulled away from their care, and now there's these people telling them what to do with their children. It's overwhelming. And so this isn't about me, this is more than me, was kind of my mantra. So always reminding myself of that. When I became a manager, there was a moment where a client spit on the wall, and then blood and spit ricocheted and hit me in the face. I dealt with a lot of spit and blood and things like that in my career. The clients were there because they were very aggressive. They were harming themselves. They were harming other people. And in that moment, I was just like, oh, I don't get paid enough for this crap. I'm out of here. But what happened is I looked at the room of people that were standing there, and every single person in that room turned and looked at me. And I said, oh, I train this. If I don't handle this right, they're all watching me. They're all watching me seemed like not a good mantra. So instead, it kind of morphed into be the model. how do I keep my self-control when this really gross thing happened? That is very triggering to a lot of people. Being spit on was one of the top things that most people would say just was overwhelming to them. So slowing myself down, I was able to see that the client actually spit on the wall to show me they were bleeding. They weren't trying to spit on my face. There was a staff member closer to them that actually got more spit on them than me. I could see all of this in that moment of using this tool, grounding mantra and breathing mantra, grounding. It was quick. It was just seconds, not even a second, probably just quick. I could see all of this stuff really quick and know what to do next because I came back to myself and I could see this scene in the way I needed to. I realized there was too many people in the room. I realized men were the closest to this client, and this client escalated whenever men were near them, and they were upset already because they had had a trauma history that involved men hurting them. So I got a towel. I was like, somebody needs to get a towel. I need a couple people out of this room. I looked at another female staff. I said, as soon as I get cleaned up, we're taking over and we're going to do the de-escalation. And within 5 minutes, the situation was calmed down. I also had a relationship with this client, which that helped as well. So did the other woman that I pulled in. So that was a piece of it as well. But had I just walked out of that room, had I just left, had I just been like, nope, not dealing with this anymore, what would every staff member in that room have done? One, they wouldn't have listened to me when I said, keep your cool the next time. Two, they definitely probably wouldn't have handled that well because this kid just spit all over Dana. Right? So this kid would have probably gotten in trouble when they were just in trauma response. And they were just trying to show me what was going on. They were trying to communicate with me the only way they knew how to. They were not trying to hurt me. They were not trying to hurt the staff member closest to them. But by slowing down, I could get the staff member the care they needed. I could get this client the care they needed, and I could get myself the care I needed. So this is a powerful tool. If you already have this in your toolbox, excellent. If you do not, take some time to think about this. The bigger piece of this too is that your mantra has to be meaningful to you. Be the model is very meaningful to me. I want to be the model for the client of where the energy needs to go. I also want to be the model if I'm doing all these trainings and I'm saying this stuff. I want to be the model for the people I'm training. I don't want to say things and not back it up or do it. So that's really, really important to me. So when I say be the model and I think about that, it stands out for me. All right, Meg. Do we have I saw a couple questions maybe in the question and answer. Do we have a couple questions?
Actually, those were more tech related, so we're all good for now.
Excellent.
So
okay, then we will keep going. And I will just keep checking in if I see anything. Okay, anything I need to do tech-wise or everything's good?
Nothing that you need to do. We're all good here on our end.
Excellent. Thank you, thank you, thank you.
You bet.
Okay. One of my other favorite tools that's really simple, easy to use. I like tools that are fun, and we'll talk later about like sensory bags and things like that. But I also like tools that I don't need anything, that I can just do it with my person. The one we just did is great. This is another one, all 5 senses. This activity is so powerful when it works for someone. I use this. This is one of mine. This is one of my tools in my toolbox for myself. And I also have a handful of clients that this is one of their favorite tools, and it really helps slow them down. So we're going to do it together right now. I'm going to invite you to join me in this. So what you're going to do right now is look around the space you're in and just notice 5 things. And since I can't hear you, although if I could, it would be better, but since I can't hear you, just say it out loud. Notice 5 things around you. Okay. 4 things you can touch. Reach out and touch 4 things and notice how it feels. Now, 3 things you can hear. Listen for 3 things you can hear. 2 things you can smell, and 1 thing you can taste. And if we could open the chat, just something you noticed as you did that experience, anything you noticed. It could be some of the things you noticed. It could be something that happened to your body or your energy. Anything you noticed. Yeah. Relaxation, slower breathing. Yes, really had to slow down to do it. Presence and focus. Oh, whoa, whoa, whoa. I meant to touch the chat and I instead touched everything else. Yes, temperature changes and touching things. I'm not in tune with my space. Yes, I use this sometimes for that too. Yes, more grounded. Oh, I love that your dog's sitting next to you. Fit into all 5 categories. I hope that's good because there was smell. Sometimes dogs smell wonderful and sometimes that could not go well. Yes, great. So for this one, where I originally found this was, and keep adding things to the chat, thank you. I originally found this in the show The Fosters. It's a show, if you haven't seen it, about 2 women who have some adoptive children. And then there's a scene where one of the mothers and her mother are kind of in an argument and she goes into a panic attack. And her mother calms her down using this tool. Which I'm on the wrong slide, I just realized. Calms her down using this tool. And this is such a powerful one because I saw it there. And then I think not even a month later, I went to a trauma training. I was already starting to use this. And then I went to a trauma training and they talked about this. So it's already one that I loved. It brings in all the senses. It's so easy to do. Some things to think about with this one: if you're already down, it could bring you more down. So for someone who's kind of low energy, this may not be the best tool. I've found it the most useful for someone who maybe is like moving all over the place, like ADHD, can't focus, anxiety, panic attacks. I've used this a lot for clients with panic attacks as a tool to slow down the panic attack and maybe not get rid of the panic attack, but slow it down enough so they can think to get the resource they need to slow it down. I used it specifically for a client. She is 14 years old and came in for panic attacks. The family was really concerned about not wanting medication for her. She was very invested in treatment. This is one of the first tools I taught her. And within a month, this worked so well for her that she has not reported a panic attack since we started using it. She has reported feeling like she was going to panic and then using this tool and being able to think through her resources, which is really powerful. Yes, it is such a powerful tool. Yes, I was just about to add that. The next one is flashbacks. So when someone is disassociating or having flashbacks, this is another tool that helps them kind of come back into the space in a safe way. And then also, when someone is having psychotic features, sometimes this can help bring them back. And yes, I see someone in the chat. Thank you for sharing. This doesn't work for everyone. I always test multiple things out with clients and let them know we're going to try a few things and you're going to get to rate them. You get to rate them on a scale of 1 to 5 or even 0. 0 means we never try it again. So anything we try, 0 means we never try it again. 1 through 5, you get to rate things and decide what you want to practice and try. And we're going to come back and tell me if it works or not. I never tell anyone what to do. We always try them and then discuss if it helped them or not. And sometimes it does not help people. Sometimes it doesn't work for them. Also, you don't have to do it exactly in the order. I would just say that 2 things you can smell and 1 thing you should taste should be lower numbers. But if I have someone with auditory hallucinations, I'm probably not going to do hear. Or I might do hear, but say, instead of saying, what do you hear? I might say, repeat what I say to you. And then I might do that 3 times, right? I also had clients, a lot of clients that had a lot of boundary issues, especially around sexuality. And so if I said 4 things you could touch, they would immediately start touching myself or them in an inappropriate way. And so I might skip that one. Additionally, a precursor to this, if it's not a panic attack, and even with a panic attack, I might use this, but with psychosis and maybe flashback, I might say to them first, this is Dana, I'm your therapist. Or I might prompt for the parent, this is so and so, I'm your parent. Repeat who you heard me say I am. So I might really get to make sure that they're back with us if it's a flashback or psychosis. Make sure that they're back with us before we start this process. And for Siri believes that's beyond their capabilities. So there's a couple different ways that you might use this. You might skip one, you might do it differently. Interesting. Can touch be the same as what you feel? Now I'm feeling my food digesting. That is interesting. It's a little different, but it is interesting how the more you focus on yourself, the more you might start to notice what's happening in your body. And for someone who has had a lot of trauma, that might be really hard or uncomfortable. And so you might not have them focus too inward. The goal of this is to kind of focus outward, but the more in touch with yourself you are, it may be that you kind of notice more things that are happening within you and where it's happening. So that definitely could happen. That's not somewhere I go with this one, especially with trauma. This is more about just bringing us into the space in a safe way. If they went there though, and that works for them, we could continue with that process. Excellent. Thank you for all the chats and the adds. Now we're going to shift gears a little bit and move to thinking about for the client before, during, and after. And especially with trauma work, this is a really important thing. How do you manage in session where their mood and energy is and where it needs to go? So I told you I have clients that get really wild, their words, not mine, wild with the space. We're kicking balls at each other, right? We are throwing things at each other. There's a lot of stuff happening. And then I also have the clients that are yelling at each other. So how do I manage when the mood and energy, even if it's elevated, is safe and okay, right? And how do I bring it down if it needs to come down? So an example of this is I have soft balls. I have beach balls. I have a B that we use as a football instead of a real football because 1, things can get broken. 2, I have been hit in the face more times than I can say because I've played a lot of sports in my life. I already knew this was possible, even like not purposely. I've been hit in the face. And I did get hit in the face one time, the one time we played a certain game. I'll show you the tools. One time we played this certain game with a harder tool and it smacked me right in the freaking face, like flew across the room. It was Flossie from Fortnite. It was a little character of Flossie from Fortnite. I don't know why I just did the dance for you, but Flossie from Fortnite flew across the room and smacked me in the face. I had a huge bruise on my lip. The one time I used a harder tool. So if I know the energy is going to be higher, I'm going to think really carefully about what I use. And in that circumstance, I didn't hold my cool as much as I want to. I was frustrated. I asked the kid to be careful with it many times, but I knew how wild we get. I saw it coming. It's like one of those moments where you see what's going to happen, but like you can't stop yourself. Like I knew one of us was going to get hurt. This kid gets hurt on my couch. Like he will like run across the room. His mom has to stay in the waiting room just in case either one of us get hurt. And I made them sign a waiver. And I upped my insurance. All of these things happened because this client needs to get his energy out in this way. And it is okay. But at times it can get really wild. And so we have to be super careful with it. So in that moment, the energy needed to come down. I also found out in that moment that when he does something wrong, he gets really embarrassed and runs away and hides. It's also another great reason mom was in the waiting room. This is what happens to him every time at school. He gets in trouble and he hurts people a lot accidentally at school because he's rough and he's tough and he does things. And so it was a really great metaphor. We were able to work through a lot of stuff kind of around all of that as well. But my rule was we only use these soft things, and I went against my rule, and it was not smart. So where does the energy need to go? How do we move it back down? How do we manage energy outside a session? I always check in with the families. How was it after session? And we always talk about sometimes if they have a really intense play or art session, they may, or even a talk therapy session, they may have effects after, right? So it may be hard for them after. They may be in a great mood. They may be more irritable. They may be more tearful. I really want you to let me know what's happening. We also talk about the younger they are, the more the progress won't just look like a plateau. The more the progress might go up and down, right? So they may do really well for a while, and then something may happen and it may seem like they backslide, but it's just because they're growing and learning and trying to figure out new things. And so I do a lot of parent education, and I do a lot of education with the client too, regardless of their age. And I see in my practice, currently my caseload is 5 to 60, but I see pretty much all ages. And so, as much as I can in whatever way is appropriate for me to educate them, I educate them on those things. And I want them to let me know, how did it go the last week? What was going well? What wasn't working? Kind of checking in. Like I saw someone in the chat, we had just talked about that, did the 5, 4, 3, 2, 1, and they didn't like it, right? I want to know. I want them to be honest with me. Did it work or not? I want them to challenge. I want them to tell me, because otherwise I'm just going to keep doing things that don't work for them. Are there people that also need education or support? So the parents, we'll talk about it throughout. When are some of the things that I actually teach the parents or bring them into the session for? Is there a babysitter or nanny? Are there brothers or sisters? One of my clients actually wanted her brother to come to me because she had to babysit him all the time and he had tantrums and she didn't know what to do. So her brother actually started coming to see me, and we would do family sessions together. So we would do sessions all together to start to give her tools and mom tools about when, and this was also another family going through divorce, of when the brother kind of got into these moments, what they could do to support them and also like keep their own cool. And so that was so important. And then when there are missteps outside or inside a session, and how do we handle them? How do we have repair? And that's really common with trauma, is that there may have been a lot of missteps without repair, or there may have been a lot of abandonment or things where they did something wrong and got moved placements. Some of the kids we worked with had 100 placements. And a lot of times they had placements because they were kicked out of a house or something just quickly. They don't even know why they had a placement. They just got moved and they had no clue why. And so having a misstep feels like everything's going to fall apart, because it always has. And so being able to have missteps. So going back to the boy where I accidentally got hit with the Flossie character, I got really stern with him. And I said, we have to be careful, because he hit it a little hard to me. We have to be careful with this tool. And his response to me was, well, you were bragging, so you deserved it. I was all cool until he said that. And then I was like, well, what did you just say to me? Did you just say that I was, because I like did something cool with the character. Like it landed in this like cup in a way like I didn't mean for it to. And I like did this, and it wasn't, usually I go with his lead, and I got excited, a little too excited, because I thought it was cool. And I thought he was going to get excited about it. And he's like, no. And I was like, oh, we're not excited. So then I got hit in the face shortly after, got it right. And then he says to me, well, it's your fault. You shouldn't be bragging. By the way, this client had also just recently referred to himself as God. So it was very interesting, this whole scenario. And I was like, well, we have to play with something else. We can't play with this anymore. And I kind of went into that place of, I was forgetting a little bit my grounding, my mantra, and my breathing. And I went into a little more of like strict mode, which I don't do with him. And that's immediately he started crying. He said he hates therapy. He's never liked it. It's not fun. He told his mom that therapy puts love in his heart. So this was a really quick shift out of nowhere. And that's when kind of all of this happened. He wouldn't listen to me anymore. He just shut down. I brought mom in to talk to her. And that's when she said, this happens to him. He falls apart. He falls apart when someone raises his voice at him. He falls apart when he does something wrong. He usually goes and hides. He wasn't hiding. I took that as a good sign. But that's when I came out, and the misstep that I apologize first, is I know how hard we play. And I let us play with this toy. And
I'm sorry.
And I didn't respond in a way I wanted to. And I hope that you come back next week, because he was saying he never wants to come back again. I hope you come back next week. No one's in trouble. It was an accident. It's okay. And the only reason I could do that is because after my small, quick reaction, I remembered my mantra, my breathing and my grounding, and I did it. And I said, wow, what is he communicating to me with these words right now? Who has told him he's bragging and tried to shut him down? Or does he not feel good enough? What is happening? And so getting underneath all of that to see what's really going on, as opposed to getting stuck and lost in this noise that was happening right there. You deserved it. This kid has a lot of empathy. I know that. I see him all the time. That sounded like a non-empathetic statement. Like, I meant to hurt you. He didn't. It was an accident. It was an accident. I knew it was. And so being able to get underneath, being able to have that conversation with the mother and see that this is really what's happening for him in the real world, and that he's struggling in relationships because of this, and being able to use that in the therapy moving forward. All right. Rose, bud, thorn, and leaf check-in. So now we're going to talk about some check-ins that we may use pre or post session. So one of my biggest things is I always do some kind of introduction to bring us into the space. And I always do some kind of closing to kind of close the space as well. So trying to cap everything and leave it. And this one is one that probably everyone has heard of. This is a really great one. I added the leaf though. So that's kind of my portion, and I made this in Canva. But the rose is what is something you are grateful for, or something really good that happened since our last meeting. The bud is what is something you have learned since the last time we met. And then the thorn is what is something challenging or stressful that happened since we last met. So those are pretty common. This is a great parent check-in tool that sometimes parents do after school at the end of the night. So that's a very common one. I added the leaf. What support would you like today? I think that's a really important part to add. So now I know what's going on, but I also know what you need. Because so many times we give what we think people need and we don't really know. And I think that's really, do you need to play? Do you need to create art? Do you need to hug? Do you just need someone to help you problem solve? Right? So being able to kind of ask that fourth question and get the support you need. Or did you just need to tell me what happened today? So this is a great, quick, simple one. I will say it's a quick, simple icebreaker, and then icebreakers at any point in time could actually really end up going a lot longer. So be prepared for that. But this could be a quick check-in. And again, a great tool for parents or aunts and uncles or anyone to check in with the people in their lives. It's so much better than how was your day, right? Maybe it's even for spouses to check in with each other or partners. Okay, during session, we already talked about this, open check-in and icebreaker, how to slow down and switch course, matching their energy, allowing the energy to happen versus shifting it. Lisa Dion has some great work in synergetic play therapy on the importance of not stopping energy, even if it's aggressive, but kind of moving it into a safer place. And I think that's super important. Just stunting stuff or keeping it. This is something actually another colleague and I are working, we're doing some writing for grief and loss. And that's another thing we talked about a lot, is that a lot of the clients that come to us are told that their therapist said, you can't be sad, like, don't be sad on the anniversary, like, kind of move through it. They wouldn't want you to be sad. And just the importance of sometimes it's okay to just be sad. You don't have to stop someone from being sad. It's okay to give myself permission to be sad for a day about this loss that I have that I'll never get back. And so kind of where are the spaces for that? And then when to move forward, when I need to move forward. During session, tuning into your energy, where are you? Where are you as the therapist? Where are you as the person providing the service? Also, where are they and what can you tell about them based on both what you're feeling and what you're noticing them? So for this boy, that experience that I just told you about, I was feeling lots of bad words, actually. I was feeling like, what the heck, what? How are you talking to me like this? I was feeling all this. And then I had to remember that everything is communication. And something that was happening there was about him showing me his experience in the world, how he feels in the world, and being able to kind of really cue into that. Check-ins throughout session and then check out to leave the room. So we have already talked about getting hit in the face with Flossie. Building a fort. That's another one. So I have a couple kids that will take every item in this office to build a fort with. And I have told everyone that there's a couple spaces that are off limits that have like paperwork and maybe private artwork and things like that. Like anyone else's artwork, even if it's out drying, is off limits. But they know the spaces that are theirs, and they will consistently check me on this. And they will be like, can I move these chairs around? And I was like, well, I don't know if we should move the couches. And they said, they'll say, Dr. Dana, you didn't say that the couches were off limits. I'll be like, you're absolutely right. I did not say the couches were off limits. So being able to check in with myself when I do set boundaries that maybe don't make sense and allow them to be challenged, and then really be firm with the ones that are really important. So like one of the rules is no paint or slime get on the floor. You can get it all over this table. You can ask me to put stuff down on the floor, but if we're going to use it, it has to stay on the table. I have this table that is like from IKEA. It's white. So I was not happy with it when I first got it. So I was like, how will I keep a table white? But it is the best table I've ever had in my life. It just wipes off clean everything. So you can get anything you want on the table, but it can't get anywhere else. So there's those rules. But then there's also this kind of management I have to do with myself and checking in with them. Does it make sense to move the couches around? Is it safe? Are we going to hurt ourselves? If the answer is no, not no to all of those. If the answer is yes, it's safe, and no, it's not going to hurt us, maybe it's okay to move things around. And then I just know to gauge kind of time-wise what I'm going to need to reorient my office. And the last one is paint all over the body. Paint all over the body. So I just told you the rules, right? On the table, we can't get it on the floor. So I had a client getting really excited with the paint, and it's washable, right? It's washable paint. I make sure to have washable paint, and we're doing spin art. And then somehow the spin art is green and it's getting everywhere, and there's more and more paint. And it's not even a lot of paint. It was like a little thing of paint everywhere. And all of a sudden it's all over them. And all of a sudden they're actually like putting it on their body. It's not just like getting on their body. They're actually painting their body. And I start to say, hey, keep the paint on the table. Dr. Dana, you said don't put the paint on the floor. It's not on the floor. You never said don't put the paint on the body. And you said it's washable and non-toxic. I was like, you are absolutely correct. I did say all those things. Okay, great. So now there's paint all over their body, mainly the arms. There's paint all over the table, but there is not a drop of paint on the floor, not a drop. So I'm having to reassess, I'm having to look, I'm having to say, okay, you are following directions, very creatively following directions, but you're following directions. Then we go to wash off the washable paint. Do you know what I learned really quickly? Green watercolor washable paint is not actually washable right away. And so now they're green. And I take them to their parent. I'm like, I'm really sorry, this isn't washing off. And she goes, oh, we have a baptism to go to tomorrow in the morning. He immediately says, and I'm not taking a shower tonight. Fantastic. Your dad's already not certain therapy is for you. and you're now going to go home green to go to a baptism. I'm getting fired. Yeah, luckily mom loves me and thinks I do a great job with her child. And luckily they went to someone's house with a pool and tricked him. He didn't know that pools were the same as showers. So the chlorine got all of the paint off of him fantastically. So he went to the baptism, not green. But we are also able to discuss, so his diagnosis, I don't know if anyone can figure it out from what I've shared yet, not trauma, he has something else. But there's a lot of sensory-based stuff along with his diagnosis. And he actually really enjoys the feel of paint on his skin and things like that. And he does slime almost every session. So there's a lot of sensory-based stuff going on with the work with him. And so ironically, I bought actual paint for the body and we used it one time and he never used it again, because you only want to paint on your body with things you're not actually supposed to paint on your body with, right? But needless to say, check-ins. I was checking in. He was challenging in a way that was appropriate. This client is on the spectrum and very, very logical. And if I give him a rule, he follows the rule. And if I set a limit that doesn't make sense, he immediately calls me out and checks me on it. I've done a lot of parenting work on like, how do we support him because of that? So like this rule, I never said you can't put it on your body. There was no reason not to. And so when I started to say we can't put it on our body, he's like, Dr. Dana, there's no reason not to. You didn't say we could do that. And I was like, oh yeah. Yep, I didn't say that, did I? I never said we couldn't put it in our body. That was never in any of the rules we ever made. And we don't have a ton of rules for the space. He does pretty child-centered, which means he kind of comes in and he knows what he wants to do in the space. And I let him lead and I follow. And then occasionally I'll introduce some stuff and we'll do a little more work that way. But yeah, so it was about kind of all of these things. And then checking in with the parents and not being fired and everything being good. Very, very interesting. All right. Another very important part of this, documentation. How do you document? How do you document? How do you document? One, if you're not an art, a play, a music therapist, if you do not have the certification, do not say art, play, music therapy. This is really important because you are not doing art therapy, you're not doing music therapy, you are doing really amazing creative work. But if you don't have that training and certificate, you are not doing it as therapy, you are using this in your therapy. And so this is in your handout, and this is a way to kind of think about what are you doing. Second reason is no one cares you did art therapy or music therapy. They care why you did what you did. So even as an art therapist and a play therapist, if I use music, which I often do in my sessions, I do not ever write music therapy. What a music therapist can do in their space because of their knowledge and their training is so far beyond what I do using music. Is what I do using music super therapeutic and amazing? Yes, it is not music therapy. I am using music in an expressive way with my clients when I use it. I really believe in honoring those spaces and the work someone put in to get those degrees. And I also believe in honoring that everyone can use these modalities in their work. And so that's something I feel really, really strongly about because it does take a lot of energy. And for years, I've been an art therapist for years, and I just recently did play therapy. I have always used play in my work. And I will tell you now, doing the play therapy training has taken what I used to do to an entirely different level. The work is deeper. I can do more with it because I understand the language of play in a very different way and how to lead and guide or follow. There are just things that I learned and that I know actually doing a play therapy certificate and the training that I did not know before. So honoring that and kind of understanding that is super important to me. So this is why I created this cheat sheet, because I do a lot of trainings for people that don't have those certificates for many reasons. And how do we talk about this in our notes? One, so that whoever is looking at your notes can care, right? Because Department of Mental Health for us does not care I did art therapy. They care how what I did helps this client meet their goals and get out of treatment or placement. That's what they care about, for good reason. So, action verb: engaged, utilized, created, participated in. You could use other ones. The activity or task: collage, art activity, worry doll, letter writing. So say what you did. Say what you did. Designed to address, elicit, encourage, assist, increase, facilitate, whatever it is, the client or families. And then what is the skill from the diagnosis or the goal that it works towards? And then you may even drill down a little further. So this is kind of what we did for them, and then we'd add their response in. And this is something that I've supported a lot of people in doing, because I do think that this is such important work. And I do think in honoring what we've done and also honoring the work other people have done and the training they've done. And with my expressive therapies PhD, I got to work alongside. So our cohort had people that were art therapists, that were play therapists, that were drama therapists, that were music therapists. And so I dabbled in learning a little bit about all the other modalities. And even though I already knew, learning how much they had to put into their work and how much I did not know was really powerful. Really powerful. Okay. Psychoeducation. So we've done a lot so far this morning. So I want to do a quick check-in with the question and answer. We're kind of moving into another subset. So Meg, I'm going to ask you if we have any questions in the question and answer, or if you want to put something in the question and answer right now, since we're moving into psychoeducation, kind of moving out of the categories that we were just working on. Anything before we move?
Right now, there was just a question. Would you give some examples of the 5 senses bag? Sorry, did you get that?
We will give examples of the 5 senses bag. We will be talking about those a little more in depth a little later when we get into a different section of this. I know I've been talking about it a couple times, but let me give you a little teaser so you know. So it is literally a bag. And I bought them off Amazon, and I get them for all my clients, and I usually do it with the client and the parent, and we find something for each of the 5 senses. And there's a book, 2468, This Is How We Regulate, is really where I got kind of the example from this, from the training I did with this person. And their book in the back, it talks about kind of sensory bags. I do mine a little different than theirs, but this is really where I got kind of this idea from. And I give them the stuff. So I purchase and I invest in this, and everybody gets one and their parent gets one. So I know they know how to use it. But there's certain tools that I'll replace, and certain tools that the parents and them have to agree to replace if it gets lost or messed up. And I have some examples over there, so I'll show you some of that stuff a little later. But that's just an example. So kind of like the 5, 4, 3, 2, 1, the all senses activity. We do this in the same way. So I might do it in one session. I might do, depending on how old they are. Some of my younger clients can't do each, like they can't sit a whole session doing it. So I might do one piece per session and decide what they like. But it's something they can use for school. It's something that they can use at home. Some parents will create a separate bag where they can have one in the car for car rides, like wherever they kind of struggle. And we'll talk a little more about what all the different things are in that. But thank you for asking that question.
Here's another question for you. What if a client says they can't smell or taste anything? This happens a lot in my office, and so I have adapted it from using senses to using different colors, but it's not as mindful as the senses.
No, I think that's fantastic. I think we have to adapt to whatever. The one thing that I would say is, if I do have a client that's continuing to say they can't smell anything or taste anything, I might want to make sure they go to a doctor just to get anything checked out that they need to, like a medical doctor, to make sure there's no other issues around that. But that is very possible that could happen for someone, or that just some of the senses don't work for them. And I think adapting it is fine. I think it's still very mindful. But that is a good question of like, how does that impact you? If they really can't taste or smell anything, not just in your office, but all the time, that could be a place of work for the therapy, because that could be really hard. And I also wonder if that's related to like long-term COVID effects, because I know that was a side effect for a lot of people, or if that's something else. Kind of where is that coming from? I might explore a little bit, because if I think about how much I enjoy food when I eat it and how much I wouldn't be able to enjoy food if I couldn't smell or taste anything, it just makes me think about that. But yes, I think we have to adapt to whatever makes sense. I have a client that there's this kind of wood chop thing I was taught in the EMDR class, and they really wanted to do it, but they have a slip disc. They really want to do that movement, but they can't. They're not allowed to. And I also use a weighted ball a lot of times, which they're really excited to use, but they can't use it because they physically can't do those movements with their body. It doesn't matter if that would be the perfect activity for them. If I know they would enjoy it, we had to adapt to like what their body could do and what is okay for them so they don't injure themselves. And sometimes that's just going to happen.
Great. Thank you, Dana.
More questions?
That's it for now.
Okay, great. Excellent questions, everybody. Thank you. And I so appreciate all the participation that we've had so far. We're going to keep having it. So keep it coming when it's time. All right. Where are we? We're in psychoeducation. That's where we are. We are in psychoeducation. So when we think about psychoeducation for trauma, we want to introduce the trauma frame, normalize big feelings, normalize common adaptations, and introduce alternatives. Sounds simple, doesn't it? But it can be so complicated because we have so much great information and wonderful information. And depending on some of your clientele, they do not care. And that's my favorite thing. My husband is military, and he's a mechanic, not in our field at all. And I must have talked about the ACE studies, I don't know how many times. When I started learning about them, I'm like, hey, babe, you should probably look into this. I wonder what your score is. By the way, I already knew his score. I was like, yeah, I don't know if that would help you at all. Didn't listen to me one time. He's like, hey, babe, to me. He doesn't actually call me babe. We're just going to pretend that for now. That's what it felt like he said to me. Hey, babe, I heard this really cool podcast from this guy, Bobby Lee. He's a comedian. He loves his podcast. And him and his brother were doing this thing called the ACE studies. This lady is so smart. Like, I don't know if you've ever heard about this, but she was talking all about it. And I was like, oh, was she? And then proceeded to play the podcast for me and make me listen to it. It was actually quite interesting and very funny. And I was so glad that he shared it with me and that he was introduced to the ACE studies. But what it also said is we sometimes just have to hear it in a different way or find it ourselves. Because like hearing it from this comedian that he really appreciates was kind of the way he could take in the information. Same thing. He also did personal training in his lifetime, and he tells me what to do all the time with, workouts. And do I listen to him? Absolutely not. I mean, I do, but I don't. And I would come home, he would tell me this, I would come home and I'd be like, dude, my trainer, because I started going to a trainer, my trainer said to do this. And he's like, I was telling you that 2 years ago. So sometimes when we think about psychoeducation, we have to get creative with the ways we learn. So for him, doing traditional therapy doesn't work for him either. Listening to podcasts like this one with Bobby Lee, where they talk about trauma and talk about what happens in your brain and body, is the way that he learns better, where they're not making fun of it, but they were having these insane aha moments that they had never realized as brothers together. Or he one time came home and said, hey, I have a book you have to read. I want you to read this. This is my new therapy. And it's David Goggins. David Goggins is a Navy SEAL who had been through a pretty traumatic upbringing and wrote a book about his experience and kind of what he did to support himself. And so finding different ways for different people, I think, is really important because everyone needs different types of support. And everyone needs different ways to get to their psychoeducation. So tomorrow, we're going to call it a growth assignment tonight. Everybody's going to have a growth assignment tonight. And tomorrow, you're going to share back something. So we're going to have something kind of first thing in the morning tomorrow, or earlier in the morning before the first break, where you all get to kind of teach back in the chat some of the things you learned about whatever you get assigned. And the reason for that is, and the reason I add this in here is because those can be the most valuable ways for someone to hold it. So if I tell you what the ACE studies is, you're going to like get it and you're going to hear me, and then it's probably going to go out of your brain. But if you went and did some research and learned about the ACE studies, it's going to hold in your brain a lot better. And you're going to be able to introduce it in a way that made the most sense for you versus what made the most sense for me may not work for you the same way. And the other place that we always have to start when we think about psychoeducation is fight, flight, freeze, submit, and comply. Now, I am using the term submit and comply, but I'm going to talk about that in a second, because some other people may have different terms they use, and I think that's absolutely fine. When we think about terminology and language I use, this is what has worked for me, what has worked for my clientele. It's kind of the language of some of the modalities that I use, but you may work in a different area with a different group, with a different modality where other words make more sense for you. And I think I invite you to make sure that that works for you and that it feels genuine. My play therapy supervisor told me to tell one of my parents something, like in setting a limit with their child. What did she say? I've even blocked it out of my brain. It was just so like gentle and sweet and nice. And I was like, I can't even with a straight face tell my family to say this to their kid. Like, I don't think I could say that to my kid the way she said it. Like, she is just the nicest person. And the way it came out, I was just like, this dad is like still spanking a son who's hitting other people at school now. And we're trying to like help dad understand not to spank. Like, this feels like way far over here for him. So we're having to like come to the middle a little bit. And he's not doing anything harmful. He is nothing reportable. It's within the means of what is okay to happen in your household, but it's not working for his son. And we're trying to help the family come to that understanding is that, you know, is this the best way to help him learn a lesson? But if I start to bring in language that is so far away from where this dad is, I'm going to lose him totally. So I digressed a little bit, but I think that was important. So if there's any language in here that doesn't fit right for you, but something else does, definitely consider that and consider what the modalities you use are and what might fit more for you. You may be more comfortable with the language like my supervisor would use. I've worked with really rough and tough adolescents for many years. And while I'm really mindful not to curse around them, I also have a military husband at home. So that's a little more comfortable type of language for me. And I actually have to make sure I don't slip into that during my sessions. All right, so fight, flight, freeze, submit, and comply. Walter Cannon originally kind of introduced this in the 1920s, really thinking about how animals react to threats with a general discharge of the sympathetic nervous system. And so fight and flight were the two that were originally talked about. So when we kind of define these and break these down, fight is actively confronting danger, standing your ground, defending your position, attacking, digging in, persevering, going in, going towards. So movement towards the danger, not moving away from it, moving towards it. And this could be physically fighting, this could be verbal, or this could be, I think about like when working in the residential system and the hospital system, like if a code green happened, who's the first ones to the code green? Like, I know that's me. Like a code green gets called, I'm not allowed to respond to them anymore. And like I have, my body is like fighting itself to respond to a code because I did it for so many years. And I now got promoted to the corporate offices, and my boss has told me when I go back to visit the adolescent center, I'm not allowed to respond to codes, and it is so hard. But that is a fight response. So it doesn't have to be necessarily a negative thing, but it's moving towards whatever that danger is. Flight is getting away quickly, leaving the danger behind, moving towards safety. giving way, retreating, discarding, removing yourself, giving up, moving on, right? So flight is getting away. Then we have freeze, a state of extreme vigilance and arousal despite a physical stilling and no observable movement. It may be thought as an attempt to remain unseen, unnoticed, or untargeted by the danger. So if you think about a young child and a parent who's fighting another parent, I can't fight them. I'm not big enough. I'm not fast enough to get away. But if I just hide or freeze, maybe they won't notice me, right? So it's a survival. We're not thinking through this. It is way back in that first part of our brain that develops. It is survival. It is happening in seconds. Fight, flight, freeze. You may not even be realizing you're doing it if this isn't something you actively think about. Freeze could also be thought of a different way too. So it could be the stilling. I was supervising someone who had an incident at the adolescent center where all the staff complained they did nothing during a crisis. And this person was insistent that they were moving at the speed of light, that they were doing everything they could. And we had video cameras, so we were able to get some video. It didn't have sound, but it had movement showing of like what happened during this incident. And I think what the staff was saying is that someone got hurt because this person didn't intervene in the way they needed to. And so I had this person tell me their side of the story from their perspective. I had heard the other side already. And then I had watched the video. So I knew kind of all the perspectives, had them share theirs. And I said, let's watch the video together. First, let's just watch it. And then let's watch it again. And I want you to walk me through kind of what you notice now and what you're thinking. And they said, well, you know, I was moving at the speed of light. I was all over the place trying to help and trying to support, doing all this stuff. When we watched the video, there was a hallway, a pretty long hallway, and there was a space about this big between a room and another room. And this person was just like, slowly walking back and forth. Not fast and only in this certain area of the space. So they were moving and they were thinking, it was a very slow area. And I said, what were you thinking in that moment? And they said, I didn't know if I should run and get help or stay and support. So while there was movement and while there was thinking, they were really in freeze, stuck, not knowing what to do. So that's another way to think of freeze. This last one, submit and comply. A strategy used to remain alive when an individual is under attack and when fight or flight are not possible and remaining unseen is no longer an option. The act of submission to appease or accommodate the attacker and allow the individuals to survive the experience. So submit and comply, you may know it or hear it as fawning, folding, appeasing. There's several different terms for this one. This is newer in a lot of the trauma literature, which is why I think no one has really fully agreed on what the final one is called. I think no one loves any of the options, but the idea of this one is the appeasement, that you are appeasing the danger to stay alive. So a couple ways that we can understand this one. One, a more kind of extreme example, I have worked with several people who have been trafficked who said over and over again that they would give in to being raped by a buyer. They would call them a date, be raped by a date, do whatever they wanted, even when they didn't want to, and it hurt them, in order to avoid getting killed, getting beaten, or getting kicked out of their family. Family is what they often called the people that were trafficking them. So they were giving in to one fate, which is this rape, this danger, to avoid a worse fate, or getting killed by the person who was buying, right? Because that was an option. So they were giving into this, appeasing this, even if though it was at the risk of other safety needs for them, to avoid this one, which was worse. So that's one example. Another example, lower level. Everyone on this call has children or has been at a store with children or has watched this happen. You're at the store. Let's say they're about 2. You have a 2-year-old with you or someone else does, and they want something that they can't have. and you have to tell them no. Immediately, chaos ensues. They are screaming, they are crying, they are losing their minds in front of everybody in the store to make sure everyone knows that you are the worst parent, auntie, babysitter, whatever in the entire world. If you have ever then said, okay, fine, you can have it, that's our submit and comply. Our brains and bodies are hardwired to belong. And what that triggers in us is we are going to get kicked out. We are not good enough. We're going to get kicked out. This child is screaming and crying. I need to make it stop. So if we've ever given in and given them that thing, we are appeasing them. We are giving into that submit and comply in order to make this kind of crisis stop. Most of us, hopefully over time, learn how not to do that, how to have patience with ourselves, how to navigate that situation differently. But that does happen, and probably it has happened for everyone on this call. So that's kind of a more everybody example of how these may show up. These are not good or bad. They are just the human responses to stressors and dangers. This is just what happens for us. Why am I talking about it now in a trauma training? Because a couple things, these are great and they keep us alive, and they usually happen and then we move on. However, when the danger never leaves, this is overactivating. And it's overactivating so much that now I'm in a situation where I don't have danger, but because I'm so expecting danger, I'm responding to you that is safe in ways that don't make sense. And when someone else is always responding in this, we can start to respond in this, even if that hasn't been our experience, and add any kind of trauma onto our platform as the helper. And then that can activate us in ways we don't even realize if they're activated. That's one. Two, when someone else is in fight, we often go into fight or flight or freeze or submit and comply. When someone is in submit and comply, if we don't pay attention, we could reinforce that for them. So how does that look in session? I had a client in my session, 5 years old. We were doing a family session, an activity that I have done for the last 25 years, always wonderful, never had an issue. It's an assessment tool. And this kid got very upset by something that his mother didn't do anything actually, but something his mother did during their drawing. And he began to break my crayons, break them, very big, thick crayons, break them. And I was like, okay. So I moved a lot of crayons away from him. I was like, okay, they can only have a couple crayons at a time. It's fine. They're crayons. That was my self-care. It's fine. They're crayons. We can buy more. It's fine. It's fine. Then he walks up to me, stares me down, and slowly walks away. Broken crayon in hand. In my mind, I wanted to be like, you will never use crayons in my office again. Total fight response. He was communicating with me in a fight response, and I was about to jump right back into fight response. I did not do that. I took a really deep breath, reminded myself it was just a crayon, and I said, what is he communicating? This is assessment. What is he communicating? I decided to continue with the project. They only had so many crayons. There was only so many he could break. I was fine with it. I knew I could buy more. It was not hurting anyone. It was fine. It was safe. But he was definitely in fight response. I felt my fight response coming in. I used my grounding, my breathing, and my mantra to slow myself back down. And when I asked for their word that represented their picture, his word was broken to represent how he felt his family was. Had I set a really strong limit, had I told him he couldn't use crayons anymore, had I stopped that process or responded with my own fight response, that test that I was being given would say, I can't keep your family safe. I had to be really thoughtful. Now, again, it was safe. No one was being hurt. He was having a bit of a tantrum, but everything was okay. I made sure there was nothing breakable around him. And the next time I met with him, I made sure he only had certain options. He doesn't get the run of the office like everyone does. I set up a plan where him and I would both be successful. You may break things. I'm going to make sure you have things that don't cost a lot of money, that if they get broken, it's okay. And actually have blocks that are really soft. So if you throw them at me, it's not going to hurt. We're going to talk about how we don't throw things at people, or we're going to set those limits in different ways. Blocks are for building. Blocks are for throwing at the wall, right? We would talk about that. But that's an example of how fight may show up in session and how we may be pulled into that response too. It could be freeze. Someone else could freeze in that moment. Someone else might just want to end the session and get out of there. I've dealt with a lot of crises with a lot of aggressive kids. So aggression for me almost is too comforting, because I have lived in it for so long, working in it. So for me, I can easily kind of think about that. If that's not a training you have, go get that training. This was years and years and years of training. How freeze, flight, you can kind of see where that's going. That one kid that was fleeing out of my office when it was uncomfortable, that's flight response, right? He was getting out of the office. He goes into hide. The last one here I want to really touch on is submit and comply. And then I think Meg, correct me, but are we about time for a break? My time is totally off because of my space and time.
Yes,
okay, so let me
that'll be
finish
good
this
time.
and then we'll go to a break. Okay.
15-minute break. Right.
Perfect. I'm going to do one more slide so you can think about something during your break. So submit and comply. Why this is super important is you may have clients that come in and so you have the fight, right? The kid that's fighting everything, that doesn't want to do anything, that gets called disrespectful and resistant, who is in fight response and not able to slow it down. We'll talk about that later. But you could also have the kid that does everything you say. And that's submit and comply. I'm just going to appease. I'm just going to make everything okay. If you ask me to do something, I'm going to do it. That could be just as dangerous as the kid that's fighting and like maybe getting kicked out of stuff because they're not doing anything. I try never to tell people what to do, but always give two options. So if it is someone, I have a client that comes in and says, what do you want to do today? What do you want to do today? I don't know. Well, I know you like art. We could do this or we could do this. And they may choose neither, or they may choose something else, or they may choose one of those things. But I try always to offer two options because that builds their critical thinking and their ability to make a choice for themselves and not just slip into that submit and comply. I'll do anything you want. And sometimes we have to sit there for a little bit of time. I'll say, it's okay, we can figure it out. Think about which one you would rather do. And I try and get really careful about not just taking lead and giving. So I am still kind of giving them a selection, but maybe it's like, do you want to play this game or do you want to do art today or do this activity today? And I might have a specific activity depending on the client. So that's kind of that final one and kind of thinking the lens of not only where are they, but also where am I? And where do I tend to fall? Because sometimes we fall more in, we have all of these, and all of these are happening for all of us throughout our lifespan. But we may fall more towards one or the other. I tend to be more assertive, more direct, kind of more on the fight maybe side of things. And I have to remember that because I can be too directive. I can step in a little too quickly. I can raise my voice maybe a little quicker. And I need to remember that I have to slow myself down sometimes versus someone who maybe avoids, right? Goes away from things. Doesn't kind of dive in head on when they need to, right? It doesn't go in, may need to balance back a little bit or balance forward a little bit. And that can also help serve with your mantra. What do I need to tell myself I've got this and I can do it and kind of build myself up? Or do I need a mantra that helps me slow down and kind of take a step back? So things to think about. Okay. I'm going to leave the slide on this For our break time, self-reflection, what I'd like for everyone to do is you've got your 15-minute break, and at that time, please take your break. But also, if you have a moment as we're coming back or before you leave, whichever place you want to do it, to think about these questions. And then I'm going to have a question that I'll pose to the group as we come back from break. All right, I will see you back in 15 minutes. All right. I hope you had a nice break. So we are going to come back into the space and bringing us back. We are going to answer a couple of the questions in the chat. Then I grabbed a few of my tools to show us some of those things, and then we'll do a check-in about that self-reflection activity. So you have a little bit of time still if you didn't have time to do it during the break. All right, Meg, what are some of our questions? I know we had a couple come in about different ways to get trainings.
Right, for
And
expressive.
yeah, and so I'll say a couple things about that. One, tomorrow we're going to dive in a little deeper about all the different modalities that exist out there and kind of how do we navigate that. And so there is a section kind of built in for that. And having said that, there is a lot of opportunities for different types of trainings. And so I'll be able to offer some, but others might take a little more kind of legwork on your part to know what would be right for you. But we're going to explore that a little more in detail tomorrow when we break down some of the different modalities. And we're going to work through kind of a problem solving brainstorm about how to figure out what we're interested in and how to do more when we want to make it more of a certification versus just using some of these in our work. So hopefully that helps. And hold me to that. If you don't get the answer you need tomorrow, then we can talk more about that during that section.
Yeah, great. Thank you, Dana. That was really helpful. Okay, first question. What do you do when the breathing does not work for a client, especially for those who might have respiratory issues?
Oh, that is a great question. And I'm going to even add that breathing could not work regardless of respiratory issues, but that's really important. So a couple things are, when I'm kind of doing an assessment and talking about, like, that's always having multiple options is, we might be talking about that. So if they come in and they've already listed, I have respiratory issues, then we're going to talk about that. And maybe I advise them to go back to their doctor and ask, like, what types of breathing activities would be appropriate for them. If it hurts, we don't want them to do it. And it may be that it's not about breathing exercises, it's about more mindfulness or something else. That's kind of how we're going to work with that. They're just kind of going back to the woman who has a slip disc. She really even wants to try the activity, but right now while she's healing, she just can't do it. It's just not safe for her to. And so we just had to say, like, we're going to hold this and put this aside. We're going to try and see if we can find anything that modifies. And even when we find something, we're not going to do it together in the room. She's going to take it to her physical therapist and her doctor to see if it's even okay for her to do. So I think there's that level of it. If there is some kind of health related issue or some kind of pain or something that could cause them, then we're always going to do those check-ins. Maybe focus more on mindfulness or some other tool and then build in. Another thing with breathing, which is really, really important, is if someone tells me to breathe when I probably need to breathe my most, I am very angry at them. It does not help me calm down. I want to say, like, stop talking to me, even when I probably really, really need a breath. Some people, right, they don't actually need a deep breath in. They may just need to exhale. So for all of us, breathing it's like necessary for life. But it also feels different for all of us. And some people do a lot of breath work and they're really comfortable in it. And other people are not for multiple reasons. And sometimes I know how to breathe and do what I want, but something else works better for me. And that's okay. So exploring different types of ways to do breath is also really important. I could also not have a lot of understanding of how to breathe. We're going to talk a little more about that too, of exploring when it's more of that and comfort level. But for the first question, more specifically, if there is some kind of any kind of like physical or some type of pain it's causing, if I don't have contact with their doctor, I'm going to ask them to work really closely with them on all the things we're doing to make sure it's safe for them. Because we want it to be safe and successful. If it's not safe and successful, why do they want to come to us and keep doing it, right? So those are really great questions and really great things to consider and think about.
Okay. The next one was also related to certified in play therapy. So you'll be talking about that one again tomorrow.
Yeah. We won't be diving into all the detail. I mean, each certification has a lot of qualifications, but we can talk a little bit. And I think in some of the resources, we have some of this information, but we will talk a little more about kind of different ways you can explore getting more training, getting certifications, different options. Yes.
Okay. The next one is, sorry, I missed the thinking process behind why give kids a choice versus a directive. Would you mind clarifying this? It resonated with me and I want to make sure I understand it. Thank you and regards from Canada. Love it.
No problem. So, and I love that you're coming in from Canada. I want to come visit you now. It's not that I don't give a directive, and there's definitely different types of therapy. So I think like your modality is your modality, and there's modalities that like child-centered play therapy that does not do directives at all. The child kind of comes into the space and there's certain places you might set limits or do things, but other than that, like there's not directives given. I came from an environment where there was a lot of danger. There was a lot of kids not wanting to participate. And so I kind of balance in between directive and non-directive, depending on kind of where my client is and what they need. And sometimes one session is non-directive and one session is directive. When I do offer directives, the reason that I offer two options is because sometimes clients will just say yes to us just because. So if I say do this, then they're just going to do that without thinking. So even if I know we're going to do a bilateral stimulation drawing, so we're going to draw with both our hands, my two options could be, would you like to use the pastels or the crayons? But I'm going to try and give them choice and voice wherever I can. Couple reasons. One, it builds critical thinking. Two, it builds ability to know what you are, who you are and what you like. And three, if I just tell you what to do, you're probably going to tell me no, because your fight response is going to be stuck in a place of just saying no to me. And even if you want, I have had clients where even when I can tell they want to do something, it's like they have to say no just because they've never had choice and control. And now they're telling me no. But if I say, do you want to do this or this? Then often it kind of loosens, and they may say a third thing. And as long as that thing is okay to do, like I may say, do you want to do a bilateral drawing with pastels or crayons? And they may say, I want to do a mosaic today. And if I have the supplies to do that and it's safe for them to do that, that may be the option we go with. So it just kind of builds on those pieces, and it really helps them have a lot more say. And it also avoids the trap of the submit and comply, where I'm just going to do whatever you say, but I'm actually not healing, even though you're being directive, because I'm only saying what I think you want me to say. And there's more to it, but those are the main reasons why I really believe in offering the options. And that's also part of our de-escalation training, is that when someone is really escalated, if you think about, this is a really good one, we're about to get into this with the needs hierarchy. If you think about a time when you were really, really hungry, you were like starving, and someone says to you, what do you want to eat? And you say anything. And they're like, pizza, but not pizza. And then they start to give you options one at a time. And you're like, nope, 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 no. But if someone said, do you want pizza or do you want salad? Even if you don't want either one of those options, by being offered a choice, a lot of times our brains can start to think a little differently, versus then getting into this power struggle over what we're going to eat. And we just continue to say nothing. It kind of opens up those pathways. All right. Oh, tools. Here's my bee. Here's my nice, beautiful crochet bees that I thought would be just a soft, fun toy for people to play with, and now has only ever been used as a football. The poor wings are coming off. I'm going to have to like take it in for surgery. But it is the perfect like football size, and it's soft. And if it accidentally hits you, it doesn't hurt. This is a beach ball. This is one of my soccer balls. I use a beach ball because I will say also, if you get hit in the face with a beach ball, it doesn't hurt. We don't purposely hit each other in the face with beach balls, but they fly a lot, and we play volleyball with this. So this is something that's pretty safe for the space. There's some areas we're careful of, like there's pictures on the wall and things like that, or if there's glass anywhere, but like some of it is about me setting up my space. If I know I have a coffee or tea out and I have a client that gets a little more wild and we may have an accident, I put my coffee and tea in a cabinet and I close it up so that we kind of have more space to roam and there's not as many accidents that can happen. So that's about setting up the space. And then if we can, and this is where we practice kind of like, we have a little more restriction around this ball. It's a little harder. But this is another ball and I love it. It's supposed to be a thumb ball, but it is also, as you see, it looks very much like a soccer ball. So it gets used often as soccer. And then we can pass it and we can answer questions, or we just use it and we keep it on the ground. So this one has to keep on the ground. The other one, we can kick a little higher if we want to.
Someone's asking to see the football again.
The football slash bumblebee that I bought I bought it in Santa Barbara from this woman. It says handmade by Angela. Oh, I'm going to have to put that in the chat. I can't pronounce her name, but she makes these. And I saw it when I first opened my practice and I was like, oh, a bee. I don't have a bee. Of course I need this. And then it is now a football. So I will put her name in the chat. I think she has a store online. But it's really well made because it is held up pretty well. Just the wings. It's just going to need, I can't do it. I do not crochet. That is not my skill set. So I'm going to have to take it to one of my friends who crochets, or go back to Santa Barbara and visit her and be like, can you fix my bee/football?
When you were talking about, the choice and voice and directive, someone just commented, it also helps individuals who have experienced trauma feel more control, which they often haven't had in the past.
Yes, choice and voice and control. Yes. So a lot of control has been taken away from them, but also, that's absolutely right. Also, they've had people who were in control use control in very harmful ways against them. So being able to have, we'll talk about this in a little bit. We talk about privilege and bias, but going into that a little bit, kind of being aware that always exists in the space and always. So we will talk, I'm going to stop myself because we're going to talk a lot about that in a couple slides.
Okay, one more quick thing.
Yes.
What if you do have a kiddo that is hitting you with those things on purpose? Do you allow it? How do you handle that?
So there are so many ways to answer that question. And it depends. Hitting on purpose is a little different. I'm going to kind of refer back to Lisa Dionne's book, Aggression in the Playroom. She does a great job of talking about how to manage. And just because we have 2 days to get through everything, I want to make sure to give you lots of resources. Lisa Dionne in her book, Aggression in the Playroom, talks a lot about how to handle when you do have clients that are more aggressive and how to kind of shift the energy and set limits and boundaries. How I do that. So I had more of that experience in inpatient. Here, when I set those limits, the kids have done a lot better with it. So, usually when I'm getting hit here, they've hit me on accident. And then what we do in those cases, if it happens a little too much, I'll say, wow, our energy is getting really high. Let's shift to something else for a little bit because you and I are getting hit too many times. So I may say something like that. Or if someone is hitting me, so this is kind of from Lisa Dionne's book, something I learned from her. If someone's hitting me, wow, it's really important that you get whatever emotion I think they might be feeling out. Let's find another way to do that. So it's kind of shifting their energy if possible. And then there's like different levels of setting limits. At the Adolescent Center, we handled it a little different when people were hitting and things like that. There's some therapists who, they wouldn't even have those things in the space because that's what's happening. So if it's a client that continues to hit, that maybe we're going back to the kid who broke the crayon. How I limited him was that he only had 3 options of what we would use during the session. So I didn't give him anything that would be able to hurt me or that could be thrown. And then I'm assessing each session of what's safe and what we keep on the table kind of versus what we might change the next time. And then the goal would be that we build where he could tolerate more without breaking it or hurting me. And so some of it is about limiting kind of what I'm considering before. Some of that is that energy and how we're using that energy during the space and talking about it. And then sometimes you do have to just kind of set that full limit of we this is not for hurting each other or hitting each other with, and we have to shift on to another tool. So I hope that was helpful. The woman in the, I put in the chat. Oh, it was on the test. Okay. Now in the chat is the name of the woman who made the football. So I hope that was helpful. So kind of the answer is there's a lot of different tools and great tips and great books out there that support that. And then also it may be about that's not the right tool for that client.
Just quickly, the soccer ball, did you write the questions on it yourself?
This one is one I purchased. A lot of people do that. Sometimes they take beach balls and do that. This one is from thumball.com. It's like being a trainer for so many years, I have a lot of tools like this that I've just collected over the years. And so this one happens to have them all on it. And they have different ones that are already created. But I have done a lot where I create my own too.
And where did you say that was from? Sorry.
It's thumball.com.
Okay. Thanks, Dana.
No problem. Lots of great questions. All right. In the chat, if you could just quickly, you're not going to give us your answers to the self-reflection, but in the chat, if you could just talk a little bit about the experience of these self-reflection questions. Were they hard? Were they easy? What came up for you? Just anything you could share in the chat around these self-reflection questions. Did you hate them? Did you like them? You may hate them because they were hard. You may hate them because they were boring. You may love them. What did you notice? What stood out? Yeah, some of them were hard to find answers for. Yeah, sometimes if we've never thought about it, it can be really hard to think about it. Yes, the anxiety that happens even thinking about, right, working with aggressive or difficult clients, right? For me, that's my jam. Like that's super easy for me because I did it for so many years. I actually get more anxiety from working with a gentle client. I am so worried because I can be so direct and rough and tough that like, I worry I can't slow myself down enough and like be calm enough for a client that needs more gentleness. I've worked on that a lot. And in my private practice now, I have some clients that would fit that category. And so being a little more like slow and quiet and being able to manage that space. But it's really good that we know that about ourselves, right? Yeah, sometimes things show up that you don't expect on the list when you do them. This is also something that I will use for supervisees. I use this for parents sometimes thinking about it. I might change some of the language, or we may just like, I might print it out and we cross out some of the words to make more sense for them. But this is something that I use with parents, kind of thinking about where they have trouble with these. And I could even use this for my clients. Yeah, and that self-awareness is so important. And one of the things that I think for this one is, you know, the people I enjoy spending time with, right? Sometimes we only think of countertransference as the ones that we're having a hard time with, we don't want to spend as much time with, but the ones that we want to spend a lot of time with that we may give a little extra time to, or right, that's just as much a slippery slope as anything else. And the one time and where these questions really came from for me was I was working with a girl who everyone called my sister, and I did not. I was like, do not call her my sister. She lives in our building. That's not cool. And they would always call her my sister. I had not met her yet. We were like purposely equally not meeting each other because everyone kept talking about us. Doesn't that just say that they might have been right? And we were equally doing this, not knowing the other one was doing it. Like, I don't know why you keep telling me I'm like this other person, you need to stop. And then we met and immediately clicked. She had blue hair. She was an artist. Like, she was a little sarcastic. She was really direct. And, when we met, we clicked, and we had a lot of crisis work in the building, and all the crisis workers at the time were males, and she could not have a male during crisis. So I did her crisis work. So we got really close. She was a musician. Like, we would just sit and play her keyboard all the time. And one of our maintenance guys, amazingly, was an incredible musician. So the three of us would like do jam sessions. It was just so much fun to spend time with her. And it was all appropriate. It was all like when I was supposed to spend time with her. We did a lot of crisis work. We did a lot of the work. Everyone knew I was spending time with her. I wasn't her therapist at the time. I was just her crisis specialist. But one day, one of the other clients came up to me and said, when she discharges, do you think you'll have time for me? And I was like, what? And this client had been sitting there wanting time with me, but being scared to ask for it. And I never knew. And so wanting to give extra attention to someone or really clicking with someone, that's also something to kind of put in check and make sure you're having the forefront of your mind. Yeah. So many great questions. And so thank you for all the participation. This is really making it so rewarding today to see all of the participation and how serious everyone is taking it. I really appreciate that. Yes, great. And this is something that you may come back to occasionally, right? Things can shift and change. Being in the inpatient setting, these questions were a little different than being in a private practice setting, and my boundaries had to shift differently than they were in the inpatient setting. I almost had to get a little more firmer boundaries being out of an environment where kind of kids could find me all the time. Like now I have to remember like, oh, no, you can't just text me anytime. Like I need to set a little more boundaries. So yeah, excellent. So this might be different for you in different spaces too. Now we're going to move into another part. We're still in psychoeducation of basic needs. Now, this is from Maslow's hierarchy of basic needs. And I will say that I introduce this and then I allow people to take it where they need to. So if the Maslow's hierarchy of needs doesn't fit in culturally for them, or if the pyramid style doesn't work for them, I usually invite people to do their own. In your participant packet, I did give you the for the pyramid. And it may work for someone, but other people, and I'll explain this in a second, but I'll explain it now. When I do this, I introduce it. It started really as training. We do it as part of our de-escalation model. This is part of it. And then what I do is I allow people to go home and think about it. I introduce it, have them think about it, and then they come back the next day with their own hierarchy of needs. And that's whatever it means to them. So you could use the pyramid. Some people, I had one person do a medicine wheel. They were Native American, and so they did a medicine wheel because they said that works better for them. I had someone wrap it. It was a freaking amazing wrap. I wish I would have recorded it. I didn't, and they wouldn't rewrap it for me, but like they did a wrap. So they wrapped their hierarchy of needs and like hit all the marks and like how it applies to them. It was really so cool. Someone did a PowerPoint presentation. Can you guess that that was someone who was a teacher that I was training? Full on PowerPoint presentation. There was no pyramid, no circle, no nothing. Each slide was a different part of this. And like they used pictures to represent how these needs are met in their life. Really, really cool and what's important to them. So there's kind of any way to do this. I introduce it kind of in this traditional way and then allow people to kind of go where they want to with it. Today, we're going to keep this just because I can't do all the options. But just to get our brains thinking about it. And so what I'm going to ask you to do is in the chat, we're going to go through one place at a time. Can I name the comedian my husband likes? It's Bobby Lee. Bobby Lee. So physiological needs and survival, we're going to start with that in the chat, and we're going to annotate on the screen for you. So you're going to see our screen come to life as we're doing this activity. We're going to do our best to get all of them, but we may not be able to, which is fine because we have so much great participation. But what we're going to have you do is in the chat, I'm going to put some dots here. And so after these dots, what we're going to start with right now, we're just going to stick with physiological needs and survival for you. What is something that is important in this category? So that can be things like, yes, sleep and food. Yes, housing, food and water. Yes, great. Yes, physical touch, pain-free touch. I'm so glad someone got that one. Warmth. Yes. Did she say it has to be 7 hours of sleep? Did I see that there? Sleep has to be at least 7 hours or no good. I love that. Definitely did not meet that quota last night for myself. Yes, need daylight and the sun, right? So if we think about this bottom level, it is if we do not have it, we will die. So this bottom level is really those needs that in a short amount of time, if we do not have it, we will die. So another thing that would go on here is bathroom, excretion. Excretion would be the word to say. I couldn't think of that. So I just said bathroom. Yes, for some people, it may be medicine. I feel like I'm going to spell things wrong now because I'm going too fast. I'm going to have to let my team just annotate these on so I don't get them wrong. Another air. If we don't have air for a certain period of time, we will die. All right. So now let's hold on. Medical care. That's a good one. That goes there. Let's make sure that goes on there. Now we're going to go up to the next level to safety. So first, we're not going to die. We have what we need. So now we're at the next level, safety, access to education. Absolutely. So now what fits in safety for you? So for some people, you may put shelter and physiological needs and survival, but a home may go in safety. For other people, they may not put housing anywhere because I can live outside in the environment in such a wonderful way. Yes, doors that lock, right? My own bed to sleep in. 4 walls and heat. Cars. Ooh, that's a good one. Cars, depending on where you live, we could say cars. For some people, it just may be transportation. Yes, not worrying about being harmed. Defense of some sort. Absolutely. Privacy. And now I'm going to get really exciting and I'm going to draw something on this one for you. Let's see if this works. I'm going to draw something for you. Oh, can anyone guess what I'm drawing here? Oh, he's so cute. Yes, yes, it's a dog. It's a dog. Let me finish my dog really quick and then we're going to go to the next question. Okay. This dog is so cute. Okay, that was too big, but that's okay. You know what it is. It's a dog. Yes, my pet goes in my safety. We'll talk about that in a second. Okay, next one. Let's move up to love and belonging. What fits in love and belonging for you? Oh, bills paid has to go back in safety. That's an important one. I missed that one. Bills paid. So now thinking about safety. Oh, a job you love, a partner, joy. Yes, friendships, emotional safety, respect. Yes, these are all great. Trusted partners, cuddles. I love it. Cuddles, community. A positive community, not just a community, but a positive community or a welcoming community, right? Trust, honesty, respect. Yes. And some of you may be writing things and be like, that's not where that goes. That goes somewhere else. We're going to talk about that in a minute. Words of encouragement, time spent together, friend group, recognition. These are all so great. Let me move some of these around. I'm allowed to move things around on my screen. I'm going to move some so we can see them all. Yes. Ooh, unconditional acceptance. Giving and receive. Ooh, giving and receiving. I like that one. Okay, let's move to the next. Oh, being relied on in loyalty. Oh, loyalty. That makes me think of military. Loyalty is like highest, like number one. We'll talk about that in a second because when we think about supporting someone, we have to consider what some of their values are and how, if we ask them to do something that goes against, like if we ask, like a lot of things when military families struggle, especially when there's PTSD involved and maybe some violence, one of the first things people will say is like leave or like tell them you're going to leave, like set an ultimatum. Let me tell you the worst thing to do with someone who loyalty means life and death is set an ultimatum that you're going to leave them. So that's not the way to kind of approach someone where that's like so high on their needs list. Is, we have to think differently. It's not about not keeping us safe and staying in a dangerous situation, but it's about not like that is considered like more of a threat than a like call or wake up call. So being able to really consider different things and what makes sense in the environment and in the community you're working in. Okay. Next one. Now we're moving up to self-esteem. I like to think of self-esteem as a humble awareness of one's strengths and weaknesses. A humble awareness of one's strengths and weaknesses. So what fits in that one for you? Yes, these are all great. Yes, getting to know and appreciate your internal parts. Oh, do I hear a little IFS in there? These are great professional development. Yes, lifelong learning, self-compassion, looking myself in the mirror. These are so great. Journaling. External validation. I totally read extreme validation. This will now forever be extreme validation. External validation. Got it. Extreme validation. Sometimes I just read what I want to read. Trial and error. Yes. Allowing yourself to have trial and error, right? That goes into that humble awareness of one's strengths and weaknesses. Absolutely. Giving yourself the benefit of the doubt. Fantastic. Okay. Humility. Yes. Next and last, self-actualization. So let me talk about self-actualization for 2 seconds before you add to here. In Maslow's hierarchy of needs, self-actualization meant that you kind of transcend needs. So when you get to a place of self-actualization, you have transcended needs, which means you never take more than you need. You are only, so think of Mother Teresa, think of Dalai Lama, right? You're at this heightened level. Gandhi, right? You're at this heightened level. But if we think about us, we will have these moments where everything just makes sense, where you are in the place where you know you're supposed to be. Yes, potential realized, goals realized. For me, getting my master's, getting my PhD were huge moments for me of that. It might be having a baby, having your first grandchild, getting married. Yes, birth of your child, having that extreme humbleness where, right, acceptance of race and culture. These are, yes, spiritual enlightenment. Being a licensed clinician and getting that done. Yes. Oh, being able to pass on to the next generation. You're getting into a really important part of this is that intergenerational trauma and how, right? But it's not always just intergenerational trauma. There's intergenerational gifts that we pass along too. So seeing the whole place and the whole person and the whole self. Absolutely. Oh, this is such a beautiful list. So now I'm going to ask you another question for the hierarchy of needs, and then I'm going to show you one I did with youth. There's so many good things added to this too. It just keeps coming, finishing a marathon. I can't say I'm on that one with you, but I can say that that is self-actualization, and I'm very proud of you. That is not my calling in life. Maybe a Tough Mudder, but definitely, I don't think I'm a marathon kind of person. Giving back to the community, yes. So now when you look at all these things we have on this, say one word that either stands out or that you think of when you see all of this. What is one word? I guess it could be a phrase too. One word that stands out or that you think of when you see all of this. Yes. Beautiful. These are great. Excellent. And now if I can make my mouse work, we can clear the screen. YOLO. I just looked up to see that. I love that. These are so beautiful. Okay, my mouse has decided to disappear and not, there it comes. There it comes. It was hiding from me. Okay, now we're gonna have to, oh, this is the hardest part. We're gonna save it. We're gonna save a copy of this. Did my team save a copy of it too? Because we're gonna have to erase it, sadly, but I have saved it. Okay, great, we have it saved. So now we're gonna clear it. And I talked about using this in trainings and with staff and kind of thinking about this for ourselves. And one of the reasons that I always started with them is, and it kind of goes into some of the talks we're gonna have in a little bit, is bias and privilege. There are some of us that are bouncing kind of up and down between love and belonging and self-actualization, where our safety needs and our physiological and survival needs are so well met that when we come in contact with someone that is really struggling with those, it can be hard to think about that and to remember how scary it is when those things aren't being met, and how if I don't have enough food to feed my family, I'm not going to be thinking about your feelings when you tell me I can't get a service I need, right? Like I may not be in my best self. And so me as the practitioner in that moment has to remember that and keep myself centered so that I remember, like, I have the privilege of having food in my belly and having a lot of options for how I fill that. And I need to remember that when you're getting short with me or being rude to me, or maybe even cursing me out because you can't get a service you need to feed your family, that is absolutely not about me. And that my job is to help support you. And I will tell you right now, my biggest pet peeve is when I think, like, let's say the cable company has stolen my money. We're not allowed to have cable anymore. And I'm not allowed to talk to the cable company, because if I accidentally say a curse word, or if I'm getting frustrated because this teller is telling me that, like, they can't give us our money back, and I curse, they say, ma'am, if you curse one more time, we are going to hang up on you. And I'm like, you know what? You know where you can stick that? Now, that is not a basic need. That is cable and money that I am okay maybe without. But if I am someone that really, really relies on that, and I don't know how to calm myself down because I am worried I can't feed myself or my children tonight, I am going to have a much harder time slowing down. And it is really hard to remember that when this is the fifth person you've dealt with that is in this place, and you're having a really hard time because you're already having a hard day and something has happened for you at home. Right? So where you are on this needs list, one is important because the lower you are, if you're in physiological and survival, you're going to have a harder time supporting someone else because you're struggling. Doesn't mean you can't, but you just have to recognize that. And if someone else is really low and you're really high, that's a big mismatch. And if I'm not aware of that, I could really miss an opportunity for connection and to help someone get what they need. And that's really important. So I did this for years with staff, helping them understand. And then COVID happened, and I do an art empowerment workshop every year. So I am not an art therapist or even a therapist at this. I am an art workshop leader, and it is a yearly event that happens in the state of California. Probation and DCFS pull together. Mainly, it's usually girls who have been trafficked from all over the state for a camp, a 3-day camp. And they have an art workshop, they have a spoken word workshop, they have a dance workshop, and then they have all these other workshops going on. And my job in this workshop is to be the art workshop leader. I provide art supplies, and we do really cool art products and projects. And then the goal is that we show that at the end. So the goal is that we show the art and we share it. I'm actually about to share one thing that we did. And then we went to COVID, and I usually get the kids who don't want to talk, who don't want to be seen, who don't want to, like, make a big show of themselves. And then we're like going to have to show ourselves on this, like, Zoom environment. So it was like, how do we make this work? And so I did this hierarchy of needs with them. which I had never done with this group. Usually they got to do their own art, but like some people didn't get the supplies we sent out to them. Like it was just, I had to make sure we had things we could do. So just how you saw us annotate on the screen, they were allowed to annotate on my screen, and we did this all together. And when I first started sharing this is how my screen looked. And I shared with them what we're going to do. And I kind of talked through it, and no one was doing anything. And I was like, oh, these kids hate this idea. I was like, oh my God, no. And I had a co-worker that was supporting me with tech issues and just helping, and she knew my trainings. And I was like, oh my gosh, like privately messaging, like they hate this activity. And she's like, trust yourself. Like you always say, give them time to think and breathe. And I was like, oh my God, what if they hate it? She's like, Dana, slow down. You know what you're doing. So I slowed myself down. I used my resource. I used my phone of friends, and I just kind of kept talking to them and just kept thinking about it. And then all of a sudden they started adding to it. And I see this question in the chat. I'll get to that in a second. I started adding to it. And I was like, don't let people think they know what you need. Like this is an opportunity for you to tell people. And when I had talked about this in trainings previous to this, people thought these kids would write very interesting things on this list, like, I want my weed, I want my boyfriend, I want freedom, I want people to stop telling me what to do. And I'm not going to say those things weren't on the list, but I'm going to say that this is their list, and I have permission to share this. This is their list. So what do we notice when we think about this? Oh, I think my PowerPoint just stopped sharing. What do we notice when we see this again? What do we notice? Need for connection, right? Acceptance from others. How many times is Bible written or shown on this? So spirituality, access to spirituality. I think adults who listen is on here more than once. Yes, this isn't very different than what we would put on our own, what they're seeking for and what they need. Absolutely. And yes, I want to address before I forget and lose it, this comment in the chat. I would love to do this activity with the second accompanying pyramid where self-actualization is based and goes up to the community actualization and cultural. Yes. So there is a lot of, I guess controversy is the right word. Maslow did his work with the Blackfoot tribe, and there's a lot of discussion over whether he borrowed and co-created or stole their work. And so there's a lot of research out there that says he co-created and borrowed, and there's a lot of things out there that say he took it. And so because it happened so long ago, we don't fully know. But I think honoring where it originally came from and also honoring some of the ways that they originally did the hierarchy in the Blackfoot tribe is really an amazing way to kind of navigate that. And I really love that. So thank you for sharing that. I was going to add that in a little bit. So thank you for being ahead of it and making sure that that was in here. Because I think it's really important to honor where things come from and to make sure that we are honoring and that we are not appropriating. And that is so hard to do today because we don't always know where everything came from. There's so many things in the world now. So being mindful of those things and checking and sometimes getting it wrong, which is part of the trauma work. And then once I know better, doing better is super important. So thank you for that. Yes, I'm so glad that we made sure to add that in here. Another thing that I think is really important, yes, it happens a lot. It's not hard and it is hard. It's not hard once you know, and sometimes people know and don't do it, but it is so easy to do it without realizing, especially depending on where you come from. Like if you have a lot of access, like I live in California with tons of cultures all around me, and I have lots of friends of different cultures that we have set up a situation for our experience where we can check each other on our biases, on our stuff. We can ask questions. We can ask questions that seem dumb. Like I have that safe space and that brave space to do that. And not everyone always has those options. So yes, I think it is important to do. And it's also important that if someone doesn't have that space, that we are creating it for them so that they can do those things, because not everyone has that access. So thank you for bringing that up. I think that's we're going to keep talking about that. I think that's a really important conversation also when we think about trauma work. Another thing on here, notice that I put my dog in safety. My friend always puts her animal in love and belonging. So she has a cat, always puts it in love and belonging, talks about that's kind of where it fits for her. If you see, there is someone who put my dog in physiological and survival needs. And they were like, wait, please let me explain. I know it seems weird. And I was like, well, really, it goes wherever it goes for you. Like there's different reasons. And she said, well, this is why. I have seizures and I have passed out before and I could die. And my dog is a service dog and is trained to bark whenever I have a seizure, put his paw on my chest, pay attention to my breathing, and bark again in a different way if I'm not breathing. If that's not just the most amazing story you've ever heard in your life, I don't know what is. And so that also shows if that person didn't have their dog, how anxious might they be? How worried might they be? If someone's trying to take their dog away from them, might they not have the right words to say it when they need their dog, right? And so if I think about that, like everybody's is so uniquely different. There's a lot of overlap and a lot of connection, but there's a lot of overlap. Okay, next thing, moving into this. The ACE studies, Adverse Childhood Experiences Studies, done originally by the CDC and Kaiser in the 1990s by Dr. Bob Onda and Vince Felitti. From that original study, there have been many studies added since then, and the CDC website has everything open access that's related to this. Open access means you can go on the CDC website and get a lot of this information for free. So you just go on their website, you can learn a lot. There's also a lot of great TED Talks. I can't remember if it's Bob Onda or Vince Felitti, but I think they both have some TED Talks out there and some YouTube stuff out where they're talking about the ACE studies, the original ones and now. And then Dr. Nadine Burke-Harris, who was the Surgeon General of the state of California for a while, has a really good TED Talk called The Deepest Well. And she also has a book about it. I have not read her book. But I believe that the book just goes into a little more detail from her TED Talk is what I know about it. I do love her TED Talk. I have seen it probably 300 times because I show it in a lot of trainings. So those are great resources to learn more about the ACE studies and also to educate, like having people sometimes watch Nadine Burke-Harris's video, right? We also have what I talked about earlier. So there's some podcasts out there with some comedians that talk about it. So finding and interesting in different ways to kind of gain understanding and access about it. And then on the right side of the screen is what are some of the questions that were reviewed. So there's 10 questions that were asked, and it was from 0 to 18. Did these experiences happen to you from 0 to 18? And it's kind of a yes or no. And so some of the things they found were that kids are not necessarily resilient, that's the wrong word to use. There are definitely resilient people, but just because you're suffering through a lot of crap does not mean you're resilient. It can mean so many different things. I'm in survival mode. I'm in different things. It doesn't mean you don't have capacity, but it's something different. So thinking differently about the language. That used to drive me crazy when I worked in one of the group homes where staff would be gone all the time, right? Like staff get fired, staff leave abruptly, and everyone would always say, oh, they'll be fine. They're used to loss. And I was like, that doesn't seem right. I was like, just because you're used to loss, doesn't that just more reinforce that loss is going to happen and give up? But it was, they'll be resilient, they'll be fine, they're used to people leaving. And yes, they were. And that didn't necessarily mean they were resilient. Resiliency is, I understand this isn't about me. I understand people leave and I'm okay with that. Not now I'm going to close up more. I'm going to stay away from people. I shouldn't trust them because everyone's going to leave. There's a difference in that. And this study really kind of showed some of that. Another statement that I think is truly, truly important is what happens to children plays out powerfully decades later and turns out to be the main force for the 10 most common causes of death in the United States. So this was a correlation-based study where they looked at childhood experiences and health later in life. It was originally done for weight loss. They had a weight loss clinic and they were seeing like either people just really struggling and not able to lose weight, or people would lose all the weight and then shortly after would gain it all back. And they were like, what is going on? And then they started looking at what might be the reason the weight came on in the first place, what might be holding them back from making healthier choices, what may be some of the things that are going on. And they started looking at kind of that what happened to you versus what's wrong with you, which Bruce Perry talks about a lot too as well. And so they started kind of flipping that and thinking differently. There were 1,800 participants, and what they found is astronomically, the higher your ACEs were, the more health outcomes that you had that were negative. So death, suicide, substance use. But even without substance use or unhealthy behaviors, the risk of heart attack, the risk of cancer, the risk of other illnesses were higher. And Dr. Nadine Burke-Harris talks about that the more that stress system that we talked about earlier works, right? That fight, flight, freeze, submit, comply, the more we need that, the more that adrenaline, that cortisol, all that stuff is pumping through our body. What is that doing to us? It's not calming us down, I'll tell you that. And the more it's activated, the more it stays activated, no matter if I have this bad behavior we talk about with substance use and other things, or unhealthy eating habits, or whatever it is, or not having the healthy eating habits and exercise. Yes, What Happened to You, Bruce Perry, that book, absolutely a great read with Oprah. Or listen, I listened to it on, it was like a podcast. It was like they were talking to me. I liked to pretend that they were talking to me. So the more of this experience you had, the more, regardless of what you were doing, this happened. Now, the great thing they learned from the study too, is that we could do something about it. We can catch preventative stuff. We can support people in learning how to regulate their system better and to slow things down. There is hope, and people can be resilient, is what they also learned. And this is another pyramid, different kind of pyramid of kind of how this looks. And this is from the CDC website. The last part of this ACEs is that's all individual based and family based. But what do we think of when we think of community ACEs? What is the community that you're involved with? Do you have a supportive community? Do you have a community that maybe there is poverty, but everyone has what they need? I remember training one time, and there's a woman from Belize, and she had moved here to America not too long ago when we were doing this training. And she said, it baffles me how people are in America. She's like, we don't have homeless in my community. If you have something going on with you, a family takes you in. If you don't have food, you come over to someone's house for dinner. Like, there's such a community that just shares and gives. And that's just how her community worked. And she was baffled by how isolated it was in the area that she was now living, and how like that's not the experience she was seeing here. And it was so interesting because even if a lot of those families maybe even made less than a lot of the people she was coming in contact with in America, there was just a different experience of it. And so that's, a piece of it. So just because there's poverty doesn't mean that these ACEs are hitting the same way. But if we think about all of these together down at that bottom, violence, if there's lack of opportunity, if we don't have that community that supports each other, if there's disruptions and discrimination and poverty, if all of those things are added in, then it leads to a whole environment of people that maybe are not able to manage themselves in a healthy way. Yes, absolutely. I'm seeing some of this in the chat that is right in line with what we're talking about. And there's another great book that I read in my research for the class I teach. I teach a class on trauma and suicide assessment and treatment at the university. And I was studying different books and reading different books to provide to the students. And one book I read, which is kind of in line with all the stuff we're talking about, which was really good, is Edward Duardo. I think I actually have it in this next slide. Not that one. This one. Edward Duran, Trauma-Informed Counseling for Indigenous Communities. And one of the things he talks about is actually that community, the need for community to heal, and how a lot of Americans have moved away to be so isolative. And Bruce Perry talks about this too, that we actually have moved away from the ways we actually need to support and heal. And that we've kind of taken it away from ourselves and everyone else. Absolutely. So this book resource list is in your handout, and these are some of the other things. We've talked about a few of these. Peter Levine is another one, which talks a lot about like what's happening in our body and how we're impacted. Kathy Macchiotti has a lot of creative intervention with traumatized youth and a lot of expressive therapy stuff. Violet Oaklander does a ton of kind of play and art-based stuff with children and adults. Francois Matthews is someone out of Canada. Francois, I actually think I spelled her last name wrong, sorry, but Francois Matthews does a lot of online trainings about burnout and compassion fatigue, and she has a workbook called the Compassion Fatigue Workbook, and it's really kind of for the healers and thinking about your work and how much your work kind of starts to feed into the rest of your life when you don't realize. Dan Siegel, he has a ton of books out, so pretty much anything from him. Bessel van der Kolk has The Body Keeps Score. These are all just kind of great resources. And Bruce Perry also has quite another, I think he has 3 or 4 other books. So really what I'm saying with this too is you're only as good as how much you are willing to put into this work with trauma as well. So being able to kind of add, and when I see someone new, kind of look into it while still handling my self-care. I do a lot of audiobooks. Audiobooks help me a lot because I can listen to it to and from work. So I try and do a lot of audiobooks. I think a lot of these are actually available, and not all, but a lot of these are available in audiobooks. So I do a lot of audiobooks so that I'm not having to sit on my whole Saturday and read a book. I'm doing it to and from work, and I'm taking that time, and I know these are the hours I'm working, and then I have my time to, I don't know, maybe watch some ridiculous reality TV or something where I don't have to think and I don't have to bring my brain in. Okay, I skipped this slide, so I want to go back to this one. Functions of behavior, just remembering that every behavior is meeting a need and every behavior is communication. So that's kind of the most important thing, kind of thinking about this. And having not enough attention means that there's a failure to meet basic needs, or having too much danger means there's a lack of safety. So I'm going to be searching for those things. It's hard to get rid of the demons inside of you because they were holding you when no one else did. It's hard to get rid of the demons inside of you because they were holding you when no one else did. In essence, complex trauma derails life. Derailed life disorder is not a diagnosis. Treatment charged with the task of rerouting or rebuilding life is a bit more complicated. So kind of closing out this section of psychoeducation, I'm always putting these in our forefront. How to identify the client needs and goals? Unearthing their treasure map. So how do we open up and think about how to support them? I'm doing some math right now for time, trying to figure out when our next break is. Meg, can you just private or text me when our next break should be so I know kind of when to gauge when I should pause for lunch?
Sure.
I am in a very different time zone than many people, so I am not sure that my lunch and your lunch would be the same time. All right, So getting into this, getting into this. Successful surfers only focus one wave at a time. So part of the work is slowing down a lot. If I have a client coming to me, and I will also say this because I've shared a lot of client stories, my clients not only agree to share their artwork, but they also sign and we discuss when I can share parts of their story. And if they tell me no, I never do. I do not share. And if they tell me yes, I always check in and make sure they're comfortable with me sharing what I'm going to share in trainings like this. So I want to add that just because I think that's a really important part of being collaborative and thinking about that. Yes, slow is smooth and smooth is fast. If I have a client that is not sure they want therapy, I can't dive into heavy work. Our work is just about supporting them and being comfortable in the space. And that is super important work. I have so many people, because I spent most of my career working with people who were stuck with me and I was stuck with. And what that means is I worked in an environment where you got the client you got and the client got the therapist they got. And you didn't always want to be in therapy. Like most of my clients were court ordered to be there or were in DCFS care and they were told you have to go to this place because you got kicked out of too many. And I would be resistant and defiant too if someone told me I had to do this thing. Okay, so about an hour from now is our lunch break, just in case anyone's trying to kind of plan their time. And there is, I believe we have a full hour for lunch is what I believe. I believe that's correct. I will be corrected if I'm not correct. An hour, and we're taking it in about an hour. Yes, the client's timing. Now, there are a lot of pieces to that, right? Client's timing could be so many things. Well, Dana, we use this modality and we only have this many sessions. I'm going to pose this to you. If I only have 6 sessions to make a good impression, and I push you to a place you're not safe and comfortable because I have only 6 sessions, do you think therapy is safe and comfortable? Or do you struggle? Right? So I do believe this is where I go back to supervision, right? Whenever I have a client where it feels like we're going a little slower than maybe it would normally be. Now in private practice, they don't have to worry about that as much because I'm in private practice. It's private pay. I do want to consider it because I don't want someone feeling like they're wasting their money with me. But when I was in the group home setting and I had clients and we had like a lot of people we had to answer to, then I needed to consider, how do I write my notes? How do I make sure I'm showing progress when my client just sits and stares at me for 30 minutes? But that's what they need to feel safe in this space right now. And that was part of the work. How do we document this? I would ask about that in supervision. We'd talk about it. Hey, I documented it this way. Does this make sense? Does this work within guidelines? Are we honoring kind of like what we need to do? And that's the way we kind of worked, one wave at a time. I gotta make you comfortable in the space first before you're going to be willing to talk to me. And I did have quite a few clients that would just sit and stare at me. And people would say, why are you letting them waste your time? And I'd be like, they're not wasting my time. This is their 30 minutes. If they want to come in and stare at me with an evil face, then that is what they do during their time. This is their 30 minutes. I'm not wasting anything. It was theirs. And that's my mentality that I always had. This is your 30 minutes. That was 2 30-minute sessions a week. But if I have 50 minutes, this is your 50 minutes, your hour. Now, if we're not making progress, that's different, right? If this doesn't feel helpful, if it feels like we're backsliding, if something's not working, then I need to readjust a little bit. But if you're coming in and you start at like 10 minutes and they can't handle me and walk out of the room, and the next time you do 15 minutes, and then the next time you ask me 2 questions or answer 2 of my questions, then we're building capacity. And depending on the level of trauma, you may have to do a lot more work than that. And also depending on the level of experience they've had of trust or mistrust and how the system has been with them. A lot of kids have been pulled out of homes that they felt were better than the homes they got put into. A lot of the clients I've worked with have been trafficked and they don't trust people because they've been told not to trust people and they've had the experience of not trusting people. Sometimes it's been, how is this white woman going to understand my life? And they've said that to me. And it's about building that trust and building, and I can't tell them why they should trust me. They have to feel it and they have to know it. And if it's not right, that's something to talk about too. Build fluidity and enjoyment. Usually in one of my first sessions, we just do something together. I have lots of question games that are appropriate for kind of all ages. I showed you the thumb ball. I have something like this. I ask questions that help them tell me about themselves. I often have people do a collage that says, put 5 things that tell me something about you on your collage. So I have different things that help me assess, but also help us start to build fluidity and enjoyment. And if I've had a lot of trauma in my life, that hasn't been an experience I've been able to have. And building fluidity and enjoyment builds safe moments in real time. Yes. As I'm going to read this chat out just so everyone can see it, because I think this is a really important thing to remember. As someone who's had a lot of therapy, sometimes I've been in a state where I have been unable to speak. There's been lots of times where it's taken time to have the capacity to engage, no feelings of resistance. I was just very, very much struggling. That is so important. So important. Because the quietness could be about so many things. I equally have the same thing. I get stuck and I get silent and I can't talk. That's why I went into art and play. Art and play is my way to get things out. And I needed people who could understand that language, because there's a difference between doing art and play and understanding the language when I might never use words. And I needed people, and I have gone to non-art and play therapist. And the only time I did, and it really worked for me, is I was trying to finish my doctorate. I was trying to get my dissertation done and I was really stuck. And having someone that was more talk therapy based actually was the best thing that I could have done for myself, because I needed to get the words out. And so having someone that pulled that for me, but in other times, I need someone who could handle that I'm going to be silent and actually still do work with them. Yes, holding the space. Telehealth activities you recommend. I still do collage on telehealth. It's a little harder if you don't have the skill set, but you can use like Pixabay or Pexel or Unsplash. Those are resources put in the thing. You can have them pick 5 pictures. You can have them share a picture they've taken that tells about them. The Oaklander model has some resources, and they have trainings also at a pretty low cost of like an online sand tray that's free. I think they have a dollhouse and a couple other things. So they offer some training on how to use those tools, but I have used the online sand tray for them to pick like 5 characters from the sand tray that tell me something about them. So I think there's a lot of different ways with telehealth to share those kind of things. The question games I have, we just ask back and forth. And if it's the thumb ball, sometimes it's been fun. Like I just go and I say, oh, my thumb landed on 2. Which question do you want to answer? And then I have responses to the questions that I answer that are appropriate self-disclosure, that I know don't go too deep, but share enough. Yes, excellent questions. All right, so building fluidity and enjoyment, just spending time doing things together. Finding bugs. We used to do that all the time with the kids at the adolescent center. Sometimes just finding a bug was some of the most incredible things we could have done. Parallel attunement. This is a really important one. So parallel attunement. This is about giving to someone what they need so they can give to someone else. So I'll explain it in a couple ways. We're going to read a book in a little bit called The Invisible String. And that is a book about connection and how we're always connected no matter what. And there was a client I was working with that had a baby, and they were in our placements. The baby would come for visits, but also had a boyfriend who was her trafficker. That is the father of the baby. And this client was stuck in between wanting to go run away and be with the trafficker or boyfriend, or stay and have connection with the baby. Because if she left, she wouldn't have connection and visits, and was always stuck in between. It was very much a like not knowing where to attach or how to attach. Now, talking to her about attachment could have worked, but what I realized is I couldn't tell her what attachment was. She needed to feel it. And so we read the book. We read The Invisible String. I read it to her. She rested her head on my shoulder. I read it, and then she would borrow it when her son came to visit and read it to him. At first, their visits were super uncomfortable. She didn't know what to do. They weren't connected at all. Then they started every session by reading my book. It was always mine, had to be borrowed. I had to make sure it was available. If I wasn't there, someone else had it in their hands to give to her. She would read the book, and then they would have this really cool session where they felt connected, and they started to have this felt sense together. And through the parallel attunement, I was giving her what she never had, that connection, that attachment, how to do it. And then she was able to do it for him. This may happen in a broader scale with maybe a manager. There was another situation where I had an employee that was not my direct employee, but I was a manager at the building, and he was really arguing with a couple kids in a way I'd never seen him argue before. He couldn't stop. I asked him to stop so I could help. He stopped. I asked him, not in front of everybody, but I kind of gave him the signal, like, I'll take over. And he stopped talking. But then I was talking to the kids. I had my back to him, and they're like, look what he's doing. And then I look over and he's like, and I'm like, okay, well, that's not helpful. And he was just really in characteristics that I wouldn't normally see him in. Like he had never, and if he did do that with the kids, he never did it in front of me. So that was the uncharacteristic thing. This was never how I saw him. So I walked away, everything settled down. I walked away, I came out, I heard it again through the door. And I was like, okay, I've got it. I asked someone to relieve him and send him to me. And I took him to my office to just say, like, hey, what's going on? No judgment, just what's going on. He's like, you're going to let them talk to us like this. And I was like, what's going on? Like, this is not how I've ever heard you respond to the kids. And they have spoken to you like this before. What is happening? I can't believe you guys let them get away with everything. And he just laid into how management doesn't support anyone. And I just let him go. I just listened. He could not calm down. I was like, I don't know what's going on, but this is not how I've seen you in the past. I don't know what's happening. I know that it's really hard. And yes, this is kind of what I'm saying. We signed up to come and work with kids who are really struggling. And this is how they respond to us sometimes. And this is what they say to us. I'm not saying it's okay. I'm saying this is what we do. So what do you need right now? He's like, I need to go home. I was like, okay. So he goes home. I tell his manager, hey, I sent him home and told him it was okay. His manager says, oh, his grandmother who raised him is dying. I didn't get upset. I didn't tell him he was insubordinate. He wasn't necessarily cursing at me, but he was definitely not being nice and saying things like, you don't know what you're doing. I let it all go. I let him vent. I reflected. We let him have what he needed, found out after what was going on. I was so grateful that I did not get heavy handed or say this isn't how you talk to a manager. I didn't do any of that. And I was so grateful. The next day he came in early. I wasn't there yet. And he went to our HR person and he said, please tell Dana, thank you for saving my job. If I was so mean to her, I was so rude. And if she had not pulled me aside, I was pretty much going to say or do something that was probably going to get me in trouble. I was not in a good space and I didn't realize it. That is parallel attunement. We are giving to others what they need to do their job. Was it okay for him to keep doing that? No. Was it okay for him to talk to me like that? Absolutely not. Does it make sense once I find out what happened that you may not be able? And he was younger. He was not clinical. He had just come out of college. He didn't have a lot of the high level training that I've had in 25 years of work, maybe 20 at that time. Right? He didn't have all this work. He was still learning. And so how am I going to expect him to be able to handle all these big things if we're not helping him handle it? So I might be doing that for a parent. I might be doing that for a family. I might be doing that for a youth. But that is parallel attunement. It's not necessarily even an activity I can tell you about, but it is more about having those spaces. Okay. Is my team ready? We're about to get into another space where we're going to annotate for everybody. Cultivating curiosity. I already saw people say that this is their gift. So this is going to be maybe your favorite one. Cultivate curiosity. This is one of my favorite activities. We're going to do the activity and then I'm going to talk about how I use it in different spaces in different ways. What do we want to think about? Questions to support building a roadmap and creating client-centered goals. Where do you feel stuck? This may be a question you're asking yourself as a therapist if you are feeling stuck, or this may be a question you're asking your client. How do you like feedback? Such an important question. How do you like feedback? This may be something that I'm working with them on how their parents or their loved ones can respond back to them, but I'm also thinking that for me. Some people love to brainstorm stuff. Some people love problem solving. Some people just want to be heard and don't want you to do anything else. The family that fights in my couch and then says like, no, we need to fight in front of you so that you can support it. What happens when you have losses? That could be anything. What happens? So these are some questions that I might be building and asking to build curiosity. And then I have a couple questions in the chat. I think that they're wanting the questions in the Q&A just so we make sure that we don't miss anything. So I'm just going to throw that out there for everybody. But since this one is right here and we just talked about it, I'll address this one. Elaborate on the difference between parallel attunement and co-regulation. It can be very similar. There can be a lot of overlap. So you are doing a lot of co-regulation when you're doing the parallel attunement. But there also may be... you can co-regulate. It's very similar, but it's different. You might be co-regulating as part of parallel attunement. So co-regulation, I think more of like if a child needs, I have a great example of co-regulation, which is also parallel attunement. I sang one time in my life in public at a concert for my doctorate. I am not a singer. I am not comfortable singing. And we had to do something out of our expertise. So something that wasn't part of our expressive repertoire, and singing is not mine. And I had this beautiful siren singer who was an amazing music therapist who somehow talked me into doing this. And we practiced online a lot. So it was just them and I online, her and I online. So there was no audience, no nothing. I could do it there. I practiced, I did stuff, practiced in my car when no one was listening. I never practiced in public because that wasn't what I wanted to do. And then I got up to just practice in front of my teacher and her while she played the piano for me. And I was in the middle of the stage with a microphone and I totally froze and I started crying and I was freaking out. And my teacher was not very parallel attuning or co-regulating wise, said, if you don't want to do this, you don't have to. And I was like, then I froze more and then I freaked out more. And then I was like in the middle of the stage. It was so uncomfortable. I like couldn't handle it. I was like staring at the crowd. There was no crowd yet. I was just not okay. And she sat me next to her on the bench of the piano and was like, okay, sit here. Then next we sang. I sang one round of it and she goes, I don't think you had a breath the whole entire song. And I was like, huh? And she goes, you have to breathe here, here, and here. And I was like, I don't know what you're talking about. And she's like, what? I couldn't breathe. I literally couldn't breathe. She put her shoulder next to my shoulder. And every time in the song I was supposed to breathe, she breathed for me. That's more, not so much the parallel attunement even, but the co-regulation. Where I needed to breathe, she did the breath for me. So I would remember to take a breath. And so there's a lot of overlap with that, but that's like a slight difference. Okay. What are your treasures? This one is going to go in the chat. What are your treasures? What are your treasures? We already talked about gifts, but maybe gifts that you bring, but maybe treasures you interpret differently. Your husband. I love it. That's it, just the husband. Yes, cats, children, family, mini horse. What? You have a mini horse? That's awesome. I lost all the rest of them because I just saw mini horse. Yes, good memories, right? So we see all of these. This is another fun way to think about being curious and finding out what someone likes. What are your treasures? What do you like? What do you bring to the table? And team, I was just kidding. I think you don't have to annotate. Oh yeah, you're about to have to annotate. Okay, we're going to get there in a second. I knew there was an annotation coming up. So this is a fun, cool way. So someone said, how do you do this in telehealth? This may be just a PowerPoint slide if we're in Zoom, and they might just annotate on my slide. You could do a whiteboard. I always also check everything with who I work with. So I have a HIPAA compliant Zoom that I use for my practice when I do telehealth. Some people have to use Doxy or another format. So I think whatever you use, I can't really give you a ton of resources because you have to get permissions and make sure people know like who has access to it, how to use it, and what works with your systems, because everyone's different systems have different operating availabilities. So if I'm on Zoom, I can annotate on the screen with my clients or do a whiteboard. But if you're on Doxy, you may not have access to all those tools in the same way. So these are things, or you could just ask and do it like this. They could just say it. They could draw it on a piece of paper and show it to you. Class items. These are getting Chick-fil-A, baking, hope and love. These are fantastic too. I am so grateful for all of the participation. I really, really appreciate it. And just a reminder, I saw the chat in there. Please, please, please put your questions in the question and answer so we make sure that we get them answered. Since we're doing a lot of participation in the chat, we don't want to get those lost, and we want to make sure we honor those when it comes up. Other creative ways to discover treasures, and we're going to go through some of these: hide and seek treasure style, scavenger hunts, create a treasure chest. Word searches. I love creating word searches with clients. We can do a word search together. I can do you can do simple things like favorite color, favorite food, things like that. I've had clients create them and take them to their families and see how much they knew about them. But that's so much fun. So we'll create it together in the session, or they'll write a whole bunch of things and bring it to me. I wish everyone knew or understood, and building a string with yourself. So we're going to talk through some of these activities. Hide and seek scavenger hunt style. This is one of my favorite things to do in person or online. So one way, so this one you can't do online, obviously hide items around the room and have the clients find them. But these can be fun things like stickers, sensory items, coping tools, things that I already know they might like. And sometimes we'll do this. One time it was Easter time, and I have these little unicorns, and I hid a whole bunch of the unicorns. And then once they found all the unicorns, and I often had their parents come in and do it with them, they both got a sensory tool. So I had some stress balls and some little poppet tools that I had gotten from the dollar store, and they were good quality too, the Dollar Tree, and it was a pretty good quality. And so everybody got to choose one of them. The parent and the child got to choose if they found all of the unicorns, which, let's just be honest, they found all the unicorns. I always made sure they did. But it was a fun way to kind of engage. And then the treasure was, they got to treasure hunt at the end and see a fun thing. I also have stickers. I use a lot of stickers, so they could choose a sticker. We could ask them to hide their favorite items for you to find them. I have a lot of clients that bring their own stuff into the session. I just have to make sure they take it out with them. Sometimes they forget it. But they could also do that in the space, depending on if they have the availability to do it in their space. Put new things in my office. One of my favorite ways to get them engaged in something is to put new things in my office and see if they notice it. So I might have a new stuffed animal, or I might have a new game, or when I put up this dartboard, to see if, because I had a different dartboard before, to see if they notice. And then oftentimes that becomes something they might want to play with, or they're curious about. I do a lot of STEM stuff in my work too. So doing things around science and the arts in that way. I have a lot of clients that like to build and create and experiment. So maybe it's a new kind of, I don't know, a new STEM item I found at Target or somewhere else. And then show me your treasure online. So oftentimes this works online when they're at home. I'll ask them to, sometimes we'll go through the rainbow and find a color, something of every color. And then I might ask them things like, show me your favorite toy, show me something that represents your heart, show me something that you can't live without. So we'll do different things that help them kind of show me things. If they're allowed to, I always check in with the parents first, because I made that mistake of not checking in with the parent. And then he was apparently in her office and touched everything he wasn't supposed to touch because I gave him permission. So I apologized, said it was my fault. And then we were very careful to ask after that, but there can be ways that we do that. And I have done this with as young as 5, but with the one that was 5, the parent was on the call with them. So it was me and the parent and the child together. The ones that have been able to do it kind of on their own were closer to 7 to 10. And adults and adolescents, actually. I've done it with them too. I've done it with all ages. Okay, create a treasure chest. So the picture on the left is one that's drawn. So it could be just drawing it and kind of putting all the treasures inside of it. It could be a collage, or on the right side, these are actually boxes that are in my office. Each client has one and it holds their artwork in it. So it holds the more 3D based stuff that we do, or anything else they want to store in my office. I have this space to be able to do that. Not everyone has that. But this could also be something they have at home, right? So actually we could make it, you could use one of those as a shoebox. So the one that's really decorated is a shoebox. That's the one they chose. Some of the other ones were just bought on sale at Michael's. Michael's had a really good sale where they were like $1.99. And I needed stuff to store 3D stuff. So that's what I did. That's also when we think about consideration of what I bring into the space. If you don't have a lot of room for 3D like storage, then don't do 3D art. I keep all of their art. That's part of being an art therapist and what we do. We do talk about sometimes they take things home and they want to, but part of the work is that I hold everything safe for them until it is time maybe for them to take it home, or I just continue to hold it. That's part of the process of learning about art therapy. And so that's something I take really seriously. So I have created a space where I have the room for that. But if I didn't, I wouldn't maybe do as much 3D stuff. All right, are you ready for another activity? This is one that we are going to annotate on. I wish everyone knew. I wish everyone knew. Write down one thing in the chat. Everyone write down one thing that answers, I wish everyone knew. These are fantastic. Thank you for sharing them. We are going to get as many as we can on the screen. And I am being quiet just so everyone can kind of read through the list. We know we won't be able to get all of them. We have so many great responses. I'm going to try and honor as many as we can. And I just want you to notice as you read through and see them on the screen kind of coming up, how similar and different the responses are and how we interpreted this question or this statement. Just pausing to look at it. Slowing it down. Yes, these are so powerful. Thank you all for being so brave and sharing so many great responses. So this is what our I wish everyone knew. So this is an activity from the Invisible String Workbook. And the reason that we added this one in is because so many of the kids I work with, not so much now, but in the past, had the experience of everywhere they went, a chart followed them. Everywhere they went, words followed them, and usually not their words, words that someone else wrote about them, words that someone else interpreted about them. And it was twofold. It was one, why should I have to tell you anything? Because everything's written there that you're going to listen to anyway. And two, this desire that they just wish people understood things differently. And from that, what I did is I actually had the clients. So I ran our orientation for many years at my building, and I had the clients actually give me quotes from them that they thought the staff should know. And this was our prompt. I wish everyone knew. And they got to answer the question. I used it exactly in their language, exactly how they said it. And we had a paper that would go into, we had welcome bags for the staff that had self-care stuff and different things. Our company was really cool to allow me to do this. Had things like a stress ball. We gave them teas. We gave them hot chocolates. We gave them different things we had talked about through the orientation. And then this was one of the things in there, the things that they wish staff would remember and know. It also goes back to having choice and voice. And it also goes back to not everyone can read your thoughts, and we have to tell people, but what are safe ways to tell them? So the activity in the workbook kind of has different hearts, and you get to write different things. This is very common also for like group home settings, foster settings, new caregivers taking over. So if another family member is taking over the care, I'm not in foster care, but I might have to go live with aunt and uncle or grandparents for a little while, or family friend. So different things that can be a way to kind of open this dialogue and help everyone maybe know things that are really hard and scary to talk about. And so as we even see from our list, some things got really personal, some things were more kind of esoteric and in the world. It's all personal, but more about me and kind of what I wish you would know about me versus what I wish people in the world would know. You could say, I wish everyone knew this about me. I like leaving it as I wish everyone knew, because I think the open-ended, it doesn't mean that it's wrong to say about me. You could absolutely do that. But the reason I leave it this way is how different everyone responds to it. They take it in the way that they interpret. So it leaves it a little more open. I do a lot of motivational interviewing work, and it leaves it just a bit more open, but you could absolutely say, I wish everyone knew this about me. Absolutely. There's nothing wrong with that. Thank you all for sharing. This is so beautiful. Okay, we're going to take a picture of this. And then I'm going to show you the one that the youth did. The one that the youth did and allowed us to share, which I accidentally moved on to a little early. This is the one they said. So just looking at this, just what stands out when you see this one? What stands out when you see this one? This is there. I wish everyone knew. Yeah, social anxiety, power differential is huge. They're strong. Yeah, just want to be understood. Freedom isn't free, right? Very insightful, very powerful. And I will tell you that a lot of the youth who get put in my art group, I'm using quotation marks for some reason. I have no idea why. I'm not going to use quotation marks. My art group would often be the clients that they said didn't participate, never talked, and they were just open when you gave them the right medium. Yeah. General theme is around hitting emotions. There's also a lot of introverts that tend to be, introverts that tend to come to my group because we have like the spoken word, and there's the dance where you're like doing shows and performances, and mine, you have the option. If you want to just do the art with me and not show it, I give you permission not to show it, and you don't have to. You can share it with someone, you can keep it for yourself. Most of the youth will choose to, but I have occasionally had people that just participate, but then don't want to show to the group. And so that became a big thing. Whereas if I did this with a different group, we may see a whole different one in a different list. Absolutely. Okay. Build a string with yourself. Build a string. Yes, introverts are very expressive. I love that. Okay, so for this one, I'm going to actually invite you to grab something around your space. Anything. It could be a Post-it note. It could be your phone. It could be a scrap paper. It could be, tissue might be hard to write on, but just something you can draw with and something you can write with. It could be anything. And if you have nothing, then just add this to the chat. What you are going to do here is think about, you would fill this heart. And if you're here in the space, I would ask you to fill this. And so you could say what you would want to put in here. I might have them collage. I might have collage materials. They can add things in. But what makes you kind of worthy of a string? What makes you feel like you can connect with yourself? Now, this is not an activity I would start with every client. If I know they're really struggling with that, I wouldn't do it. We would build up to this. But this is one way to kind of start to think about, when you think about pulling your own string for yourself, what do you think about? So I saw a lot of things in the gifts, right? Your gift may go in here. That gift that you brought in, your compassion, your empathy, that gift might not go in here. Maybe you find you have it a lot for other people, but not for yourself. This could just be pictures. It could be colors, maybe, that represent different things. So I'm going to invite you to kind of do your heart, draw a heart. If you don't like hearts, draw whatever shape you would like. Draw, heart, circle, something. And maybe in here, one of the ways that I build a string with myself is my creativity. So creativity goes in this one for me. Oh, you did not get what the string represents because I have not read you the story yet, have I? Put a pause on this one and you're going to do this one during the break. Thank you. Thank you. And we will get to the story because it's coming up. I want to make sure to read the story before break so you know what I am talking about if you haven't heard the story. I love it. Okay. Attachment considerations. We are going to talk about the timeline and attachment styles. We're going to do a timeline, and then we're going to read the book that I've been referencing a lot that I have activities for that you're probably like, what are you talking about? And then we're going to have a little bit of time before the break to make sure if we have any questions that we answer some of those before we go. Also, if you haven't moved a little bit, just move your body a little bit, do a quick stretch. We've been sitting for a long time today. So do whatever you need really quick as we kind of move into the timeline. Another thing that I'm going to add, and you can see at the bottom, I had forgotten to announce that, but as I go through these different slides, I show which objectives we're covering in each section. Another thing that I want to point out is that I have been training trauma for 13 years, working in this work for 25 years. I've taught a class for the last 3 years. And the amount of research I had to do to create this class when I already have a whole semester's full of work was amazing. I also have a great team at PESI that helped me weed through everything and think through everything. But I did 6 months of research, continuing to read books I hadn't read, thinking about things that I hadn't thought about, learning about modalities that aren't my modality, not to learn them, to know them, to do them, but to learn them enough to share about them. So the work is constant. And I will say immediately, what we knew 20 years ago, 25 years ago, we still know now, but we know different things and things have been built on. And there are some things that still apply and we still do. And there are some things that are not in our repertoire anymore. Like when I first started in residential care and in hospital settings, we put children in mechanical restraints. That means you are tied to a bed. I will tell you right now, in most of the programs I work in, they don't do that. Some places still do. And it's not brutal. There was necessity to it at certain times, but we have learned more and we know more. So we are doing different things now. So evolving is really important. We're asking our clients to evolve past trauma and we have to evolve with the times. So that is just to say, research is always important, being current with what's happening, not so that I pick up everything that comes up new, but so I question everything. Does this fit for me? Does it not? Does this make sense? Does it not? If a client comes in with something, I'm able to kind of think about that. And if I don't know, I'll usually say, let's look into that. No, I haven't heard of that thing. That's really interesting. Let's look at it. If it could help you, let's find a way that it can help you. All right. I'm saying that because this timeline of progression, I thought was going to be super not so hard when I maybe told someone on this call that, yes, of course I could do a timeline of attachment history. And then I realized that this is way more difficult than I had planned for it to be. This one slide maybe took me a month to create. And I'm pretty sure you will all show me that there are things that I might have missed even in my timeline, because there's so much involved in attachment work, not even talking about trauma now, but even moving into attachment work. So kind of moving through our timeline, our roadmap. Originally, kind of Sigmund Freud, right, is some of the work came from him, where he started talking about attachment. Thank you. I appreciate that. Looks great. I needed it. It took a lot of time and I worked really hard on it. Was attributed to the development of attachment to the satisfaction of clients' instinctual drives by mother. So that's kind of not the first time maybe we ever knew attachment existed, but the first time it was starting to be written about and talked about in that way. Then we go to 1935, where Konrad Lorenz worked on imprinting. So really looking at the animal kingdom and how some species of animals forms an attachment to a larger moving object. So specifically, he was looking at geese and how if the mother wasn't there, they would imprint on a person, another animal, and that would become their caregiver. So really thinking about how attachment looks in the broader sense. 1944, the forbidden experiment. Babies were not provided touch. Reportedly, the experiment ended after 4 months when half the babies died. So this was really also not allowed anymore. So that's even talking about how studies happened in the past to what we learned and how we changed things. Studies like the Tuskegee, which is not on here, where they gave people tuberculosis, and then when they found the cure, did not give them the cure, and continued to see what happened to them throughout the life of that. Yes, pre-RRB days, which is why they're so strict on human studies now. Yes, syphilis. Thank you. Syphilis, not TB. You are correct. Thank you, Catherine, for that correction. 1944. So this is where they had to end the study because their studies were dying. So without touch, we saw that in the needs, pain-free touch. If babies do not have pain-free touch, they become malnutrition, they die. We also saw that from the experiments of Harry Harlow with the rhesus monkey studies. 1961 saw the value of attachment versus just getting physical needs met. So there was a wire mother that had food and a cloth mother, and the monkeys would often spend more time with the cloth mother. And the ones that weren't given access to a cloth mother had a lot more aggression, and often wouldn't eat more. They often didn't take that as nurturing. Then in 1969, we have kind of all these people kind of in the same realm, where we have Bowlby, who's looking at the theory of attachment, explaining how a newborn becomes attached to the mother. Then we have Mary Ainsworth and the strange situation, which really kind of revolutionized our understanding of that. And that's the 4 attachment styles, really, which we'll talk about probably after lunch, started to kind of come into play. Edward Tronick, who's out of California, did the still face experiments. That's where they had mothers come in and they had their babies. So they reacted to their babies, full engagement. And then the mother went still face to see the baby's response. It was only 2 minutes, but in 2 minutes, the baby totally dysregulated and fell apart. And then they re-engaged. So it's talking about the good, the bad, and the ugly, that we're going to have good and bad within our lives, where there's times we're connected and times people don't connect with us. And that's an important part of the process of learning and attachment. But the ugly is when the repairs never happen and when there's only disconnect, and how difficult it is then to engage and to attach and to trust that process. So there's a lot of great work Also in here, that's around theraplay, the time that theraplay came involved. That's a subset of play therapy that involves a lot of nurturing and kind of giving back what somebody may not have had. 1980 is when we first really started talking about the diagnosis of reactive attachment disorder in early infancy and childhood, characterized by disturbance or developmentally inappropriate patterns of social relating, not resulting from, this was language straight from the book. We would call that developmental delay or pervasive developmental disorder. So we can even see how language changes over time and we shift. 2000, Margaret Blaustein and Christine Kinnenberg wrote Attachment Regulation Competency. That's one of the models I'm trained in. So Attachment Regulation Competency Framework that both works on attachment and also trauma, complex developmental trauma. 2007, Bruce Perry. So Bruce Perry is more than just 2007, but that's when the book, The Boy Was Raised by a Dog, Raised as a Dog came out. So really his work starting to write and kind of come out into the world and talk about his work and what he's found. And then we have Dan Siegel, which does a lot of work on disorganized attachment, but also Dan Siegel does a lot of work on parenting support and helping parents better connect with their children and have better attachment. Yes, and thank you for all the additions in the chat. So this is the briefest attachment lesson I can possibly give you. I think people study their whole lives to learn attachment and to know this. But this is kind of a brief, and I know there's things that have happened that weren't even on here. Yes, learning more about these experiments, what happened, educating. This is kind of a guide, right? So I'm thinking of this as a roadmap. I could spend weeks on each single one of these like stops in our road. And so this is just something that if this is an interest to you, finding those resources. And attachment regulation competency is the one I'm trained in. Specifically, Bruce Perry also has a modality that they train in, but I'm trained with Dr. Margaret Blaustein and Christine Kinnenberg. Okay, attachment styles. We're going to read the book, then I'm going to answer some questions, and then we're going to go to lunch. So everyone will know what I'm talking about when I say, where does your string go? I am going to stop sharing. I think that means that people will see me bigger. Is that correct? To my team. Does that make sense? If I stop sharing, will people see me bigger? Yes. Okay, good.
Yes.
So you can see me read the book. The Invisible String. Liza and Jeremy, the twins, were asleep one calm and quiet night. Suddenly, it began to rain very hard. Thunder rumbled until it got so loud that it woke them up. Mommy, Mommy, they cried as they ran out to her. Don't worry, you two. It's just a storm making all that noise. Go back to bed. We want to stay close to you, said Jeremy. We're scared. Mom said, you know we're always together no matter what. But how can we be together when you're out here and we're in bed, said Liza. Mom held something right in front of them and said, this is how. Rubbing their sleepy eyes, the twins came closer to see what Mom was holding. I was about your age when my mommy first told me about the invisible string. I don't see a string, said Jeremy. You don't need to see the invisible string. People who love each other are always connected by a very special string made of love. But if you can't see it, how do you know it's there? Asked Liza. Even though you can't see it with your eyes, you can feel it with your heart. And you know that you are always connected to everyone you love. When you're at school and you miss me, your love travels all the way along the string until I feel a tug in my heart. And then you tug it right back and we feel it in our hearts. Does Jasper the cat have an invisible string? Liza asked. She sure does, said Mom. And best friends like me and Lucy? Asked Liza. Best friends too. How far can the string reach? Anywhere and everywhere, Mom said. Would it reach me if I were a submarine captain deep in the ocean? Asked Jeremy. Yes, Mom said, even there. A mountain climber, even there. A dancer in France, even there. A jungle explorer, even there. Does my string, how about an astronaut out in space? Even there. Then Jeremy quietly asked, can my string reach all the way to Uncle Brian in heaven? Yes, Mom said, even there. Does the string go away when you're mad at us? Never, said Mom. Love is stronger than anger, and as long as love is in your heart, the string will always be there. Even when you can't agree on things, like what movie to see, or what game to play in the back seat, or what time to go to bed. Oh, that's right, you two should be in bed. And with that, they all laughed as Mom chased the twins back to their beds. Within a few minutes, they were asleep, even though the storm was still making the same loud noises outside. As they slept, they started dreaming of all the invisible strings they have and all the strings their friends have and their friends have and their friends have, until everyone in the world is connected by invisible strings. And from deep inside, they can now clearly see no one is ever alone. So that is what I'm talking about when I talk about the string. Thank you for pointing out that not everyone knew that. I appreciate that. And this is a book that I used as part of my trauma trainings. I started using it. I found it when I first got asked to train ARC before I was trained by Christine Kinnenberg and Dr. Blaustein. And I really have read it ever since then. I don't tell people about it. I read it because everyone has an experiential response to being read to, whether it's good or bad. It's an experiential response. And there's something about hearing the story. There's a lot of great stories out there. Yes, the hugging tree, the kissing hand. There's a ton of great ones. I'm literally tied to this book and the string. I have since met Patrice Karst, who is quite amazing. And if you email her, we'll email you back. And have co-written a book with her now. She's a wonderful mother who wrote this book for her son. She is not a therapist. She goes to therapy, but she's not a therapist. And she also wrote it a bit for herself. She had a hard upbringing and she wrote it because she never wanted anyone to feel alone like she did. Yeah, so really, really powerful. So before we go into break, we will go to any questions, or we might not be able to answer all the questions, but if we want to do a couple questions to make sure, since we're kind of closing out this section. Oh, okay. Yep, the book cover. And this is also in, a lot of these resources should be in your handouts. It might be at the end. I have a resource list towards the end, but this is the book cover.
Okay, we'll do a few of the questions. Yes, there are quite a few now. Can you explain the RAP version of the hierarchy of needs?
Oh my gosh, can I explain it? I wish I had the person to be able to rap it for you. They just wrote a rap. They actually have raps out in the world. And when I asked my staff how to interpret it and come back the next day, I wish I could remember what he said and how he did it, but he literally just used rap, like the music, rap music, to create his thing. And we all did a beat for him. It was awesome. It was just awesome. I wish I could do it for you. It was so incredible, but I can't remember it. I wouldn't be able to do justice. Great question.
If you remember this.
Oh, yes, a rap. Oh yeah. Okay. I can see how you got confused with that. Got it. Yes. A actual rap song.
Yes. This one says, can you please repeat the TED Talk and author? I'm not
the Nadine
sure.
Burke-Harris. Is that the Nadine Burke-Harris, the one about the ACE studies?
They didn't, they'll have to, let's see, it's Jean Wilson.
I can also provide some links, and which are in your handouts, but I can provide some links maybe during the break in the chat so people have that access. Yes, okay. I'll do that.
How did you use self-disclosure as a tool in working with trauma? How do you use self-disclosure?
Oh, you're going to love this answer. My students hate it when I say this answer. It depends. It depends. Carefully. It depends, and very carefully. I check in. I don't do anything equally for all clients. I do have some like kind of safe answers to make sure that I'm being genuine and being myself. So like things like my favorite color, things like, but I also don't always offer that to everyone. If I have someone that has a lot of submit and comply and they just answer with my answers, I may not even self-disclose those things because that may not be pertinent to their training, to their treatment. So delicately and always with consultation or supervision, I talk about the ways to do it. And now that I'm 25 years in, I've kind of my instincts, and I'm not allowed, but I'm able to, is the words I want, kind of know where to go sometimes. But even then I check in, and I have people that consult with me that are my friends, and they check in with me on things they've done, but I think carefully, and it depends. I know that didn't fully answer the question, but I think that's the best way to do it. And consultation, whether you have a supervisor or you're reaching out to someone, it could be a good friend you really trust their work that you kind of go back and forth and you share that space, or it could be someone that you actually pay to be give you full consultation for that time. And there's a lot of groups out there too, where there's consultation groups where people support each other.
Okay, thanks. What do you do with the artwork when they're done with sessions?
Excellent question. I think this goes to a little more of being an art therapist. So I hold on to it, and then depending on the content of the art, so there's a lot of factors that play in. If they have artwork that was really charged for them, that had a lot to do with trauma, sometimes I go through all their artwork with them, and they get to choose pieces to take with them. Other therapists I've worked with did pictures of the artwork that they got to take. Sometimes they decide what to do with it. Do they want to shred it? Do they want to do something with it? Sometimes we hold it. It depends on space. It depends on where you work. For some places, it might be considered part of the file. That's also something to consider. If you have clients that may be called into court, and your work might be called into court, then you might want to consider what you keep, because they could call the artwork into court as well. So being really mindful about all the possibilities. But I will a lot of times go over their artwork with them and decide what to do with it together, if I store it or if I keep it. And then you have to have the ability for that, if that's your choice. And sometimes they've wanted to take it and it's been okay and appropriate. If there's something with really charged imagery or they have boundary issues, it may not be safe for them to take it. So that's something to consider.
I think that may have answered the next one, because she said it was suggested not to take it home, as they might not be able to explain it to others, or be supported by, others.
Yeah,
outside.
I don't let them take a lot home unless we've created it for the purpose of taking it home. And we talk about that. The younger the kids are, the harder that is, because like a 5-year-old like wanted to draw something for their mom, that might be something they take home, versus if we've done a lot of deep level trauma work, then when it's time for the end of session, we will do things specifically for them to take home. Thank you for asking that second question and follow up, because that's really important. So that's why it depends. Sometimes I do let them take stuff home, and sometimes we talk about it and we kind of problem solve it together and decide what to do.
Okay, here is a 2-part question from Tanya. I think this will be the last one before we break. What do you do while people are completing their art activity? Do you complete as well? Are you around and engaging? What's happening during that period?
You're going to hate, everyone's going to hate this answer.
Depends.
It totally depends. It depends. Yes, yeah. I know it's so hard. And that's why any kind of training you can do on this stuff, and the more that you can do is really helpful if you really want to engage in the art and the stuff. So it depends. Like I have people where they do the art and I just sit, and it's as if they were talking to me, and I just sit and I reflect and I share. I have a client that does art the whole time and is very quiet, and I don't ask a lot of questions. I just sit in the space. I have other clients that if I'm not doing art with them, they stare at me like, what are you doing? Dr. Dana, you're supposed to do art with me. It's art time. And want me to do the art with them. And maybe they guide me. I'm really cautious when I do my own art in front of the clients though. a lot of times, like I have one client that really likes to draw with me and they choose what we draw. And then I also have to remember that sometimes when we draw together, they like my drawing better than theirs. And they'll be like, oh, we're going to switch now. And so we actually switch when it's time to color them in, and they color mine in and I color theirs in. But it really depends on the client. It depends on the work we're doing. It depends on kind of why. And the other thing, and we'll talk about this a little later too, but I never introduce an activity that I'm not comfortable with. I do have some clients that like to experiment, and they may do things I'm not comfortable with if I know they're comfortable, but that's rare. I practice. That's why I have you guys practice this stuff as we're doing it. And I would start with whatever feels comfortable. So if you're starting with like a Maslow's hierarchy of needs, or a simple heart, and kind of telling me a few things that are treasures or that you are gifts that you give to the world, right? Like starting slow and kind of testing those waters and having something I do is the best way to kind of start and get comfortable with it. And then, as we're going to talk about tomorrow a lot more, training. The more trainings you can go to talk about like how to talk about the art, how to think about that. We do incorporate a lot of that here, but there's just not enough time in 2 days to be able to do as much depth as we need to do to really feel as comfortable as I would like to help you feel. And we'll talk about that tomorrow, other resources.
Well, thank you, Dana, because your depends turned into really good examples and helped answer the question. So thank you. And we will get to the rest of them when we come back from break in an hour and 10 minutes from lunch.
Oh, we have an hour and 10 minutes for lunch.
Hour and 10 minutes.
Good to know. See you all back in an hour and 10 minutes.
So 1:10 Central Time.